Hey, Joe.
Hi, Kelly. How are you?
Good. How are you?
Good, good. I'll get my background going.
Getting situated. I'm just gonna go grab some coffee.
Yeah, no, right ahead. I just wanted to get on so I didn't
Oh yeah,
forget.
no, that's why I had it on, just because I know people are gonna start to come in. Actually, I think the waiting room is enabled, so I have to, maybe I'll disable that for now.
9:33. I'm just going to give it another minute or so before we kick things off for today. Very happy to have all of you join us this morning. Take one more minute or so to make sure that you are settled in a comfortable way. You don't have any other distractions. And we'll get started in just about 1 minute. Thank you.
Morning.
Good morning.
Morning.
Oh.
All right, good morning again, everyone. Welcome back to the New England Community Action Partnership, or NECAP, Fall Virtual Symposium. We are here on day 2, and my name is Deb Poland. I'm the Executive Director of the Connecticut Association for Community Action, or CAFCA, and I will be walking us through the day today. So happy to have everyone with us. Of course, we are going to start with just a few notes on technology, some technology housekeeping. Please keep yourself muted if you are not speaking. If you want to, you can keep your screen in speaker view, so you'll be able to see the featured speaker all of the time. You can use the More button next to your name in the participant window if your name isn't showing up the way that you would like it to show up. If you have a question during the day for any of our presenters, you can use the raise your hand feature, which you have to open up the participant panel in order to raise your hand, or you can use the chat function. And many people used the chat function yesterday, and personally, I think it helped keep the meeting very engaging for folks and dynamic. So whatever is your preference, if you prefer to use the chat function, you can do that. If you'd like to be able to become unmuted and ask the presenter a question yourself, then you are welcome to raise your hand, and at the appropriate time, we will unmute you. If you need any technical assistance during the day, you can message our production team, which are Kelly Hall and Katrina Bresnahan, through the chat function. And I think Kelly's going to put their email addresses in there as well. So if you need to email, you can do that. A big thank you to our sponsors. The sponsors for this symposium really helped to make it so that we could put together a program with presenters who have expertise, so that we could have the Zoom platform available, and also a special little treat, which we'll tell you about at the end. Our sponsors are SMC Partners, the Connecticut Department of Social Services, Mutual of America, Folsomus, Human Services Solutions, and Community Software Group. So thank you so much to our sponsors for working with us and helping to support the work of community action in New England. And finally, a huge thank you to our planning committee and production team, Joe Diamond, Dietza Wooden-Wade, Jess Benedetto, Lisa Clay, Paul Solera, Rilwan, Feyisitan, Stephanie Matrill, Rhonda Evans, Kelly Hall, Katrina Bresnahan, and Cassie Norfleet Johnson. Thank you to all of you. And now I'm going to turn it over to Cassie. Cassie Norfleet Johnson is a program manager in the Office of Community Services at the Connecticut Department of Social Services. Welcome, Cassie.
Good morning, everybody, and thank you, Deb, for the introduction. It is my pleasure to start off day 2 of the 2020 New England NECAP Fall Symposium with these opening remarks. I would like to thank everyone for attending the symposium. You know, this year, COVID-19 has changed the way we've done business, and it has changed the way we have had to do everything. But it hasn't changed the need that we've had to continue to work collaboratively, and that's with the CA network, the CSBG offices, the state association, and really how we're doing the work to serve our mutual clients and their needs. The agenda highlights the effective and flexible nature of the community action programs and the services that we do. It looked at addressing the present needs and planning for the future. And that's where we wanted to take this symposium as we work through it. So day 1 started off with Dr. Brown Dean with her keynote presentation. And then it continued with our CA peers, really describing their activities around the social justice movement and managing crisis. And what was clear from the day 1 session was that the CA network must act when called upon to serve. And I think that's what we really wanted to talk about. When you're called upon to serve, are you ready to act? Are you able to act? And do you know what to do to act? So day 2 continues with where we left off with day 1, but we wanted to focus more of the discussion around really the role of the community action agency. So the agenda for day 2, you know, as we looked at it, and the topics are going to be the first, health disparities, again, the role of the community action. What is the planning role of the CA network and the impact of the digital divide? Then our national partners are going to come on and do a panel, and they're going to be talking about what are we going to be looking ahead to for 2020. And then the final section, 15 minutes, but just as powerful, is really going to be looking at the call to action for community action. And so the first 2 sessions are requesting that the Community Action Network really hold a mirror up to itself and examine its role within the issues that have been presented throughout this symposium. And yes, we can speak the language, but we want to move beyond just speaking the words. We want to start dropping real breadcrumbs through this conversation about what are we doing on our agency level when we talk about family, we talk about community, and we talk about those agency goals. What are we really doing? The National Partners Panel will provide a robust discussion on these issues and themes that have been discussed throughout the symposium. Again, we're talking about looking forward to 2021, which is just a couple of weeks away. And are we ready? Have we thought about it? And what are we going to do about it? So when the planning committee was attempting to design this symposium, we had a really consistent theme that constantly resonated throughout our meetings. And the theme was around, will the community action agencies use this information after the symposium ends? Will it be a book that goes up on your bookcase and collects a lot of dust, or will it really be a spark to really start a fire? And so with that, we had discussions around after the attendees go back to their offices, you know, whatever that might look like. But when you go back to your office, what will happen based upon the information that was gleaned from the symposium? Who is asking that so what question with the CAAs related to the symposium and your after action steps? That's my plug for all of the Roma professionals out there. Keep asking those questions. They're very important. We want to know about that so what comment. And then we're looking at, you know, are we planning to address needs identified in our community needs assessment? Then we need to ask, were the topics discussed during the symposium addressing community needs assessment, and why or why not? And what can we do to help you figure that out? So the plant committee really worked tirelessly as we pulled all of these kinds of topics apart. And what we really wanted to do was to provide breadcrumbs to start the discussion within the CAA network and help you all navigate those kinds of responsibilities. You know, we believe that the discussion should continue within each individual CAA, within the statewide auspices, as well as Region 1. You know, as we were thinking this through, we wanted to make sure that what's the word I'm looking for? Where Region 1 sits, we get lots and lots of compliments about how Region 1 and our RPIC system works so well. I want to be able to continue that kind of work. We talk about it on a national level. This is, again, another opportunity for us to demonstrate our words through our actions. So when we move forward, we believe that, you know, this discussion should continue, and we hope that we've provided you with the tools to start that conversation within your agency. There will be an evaluation shared after the symposium, and we hope that you take the time to complete it, to let us know what you thought, how you felt about it, and what you found beneficial, what actually helped, and what we could do better for next year as we move further in this process. And I, like everyone else, would like to thank the Planning Committee for all of their efforts and the robust discussion. It was really good, painful at times, but still very, very good. So with that, I'd like to transfer the mic, if you will, virtual, back to Deb from CAFCA.
I'm taking the mic away, Cassie. Thank you. Well, I'm pleased to introduce our first session, and we're going to start with a panel on health disparities. We will begin by having Dr. Tekisha Everette speak, and then we'll have some responses by two of our community action agency leaders here in New England. So first, I'll start by telling you a little bit about Tekisha. Dr. Tekisha Everette is the Executive Director of Health Equity Solutions Connecticut, a nonprofit that promotes policies, programs, and practices that result in equitable healthcare access, delivery, and outcomes for all people in Connecticut. Dr. Everette has built a successful career in public policy, particularly healthcare policy, and advocacy in the nonprofit, state, and private sectors. Before taking the helm of Health Equity Solutions, she worked in a variety of roles to improve access to healthcare and improve health outcomes. Dr. Everette earned her doctorate in sociology from American University with a concentration in race, gender, and social justice as it relates to social policy. And she holds a master's of public administration from Virginia Tech. She's an alumna of the Master's Series for Distinguished Leaders and the National Urban Fellows America's Leaders of Change program. She's a lifetime member of Delta Sigma Theta sorority and the Association of Black Sociologists, and I am proud to call her a friend. Welcome, Tekisha.
Hi, good morning, Deb, and good morning, everyone. Thank you so much for having me here. I'm going to first do a little quick test to make sure that you can hear me. And I've lost sight of everyone, so I'm going to assume you can hear me. So I'm excited to be here with you today to give you a brief presentation about what I see and have thought about as the role of community action agencies in health equity. And it looks like I control my own screen. Is this correct, Kelly? I've never done this before, so now I'm trying to figure out how to, oh, there we go. I figured it out. Perfect. All right. Good morning again.
And Tekisha, if you could just speak up a little bit, because we're getting some chat messages that it's a little hard to hear you. I think your mic's a little bit low.
Okay, that's great. Thank you. I will turn up my mic over my end as well. So as Deb mentioned, and thank you, Deb, for that introduction, Health Equity Solutions is a nonprofit organization, and we started about 6 years ago with the focus of squarely focusing on health equity through policy and advocacy solutions throughout the state of Connecticut. I'm excited to be the inaugural executive director, and this is my first opportunity to speak to community action agencies, both in Connecticut broadly and directly, and also within the whole New England region. So it's really interesting and exciting to do this morning. I am not certain that an organization exists like ours in other states, but it's very important to me that there is a clear connection between what community agencies do, community action agencies do, and the role and health equity in general. Because I do believe, and you'll hear me say this again, that there's an essential and critical role. So today I'm just going to go over a few quick, I am not sure why I now cannot move these slides. Is this me? Okay, yeah. So I'm going to go over a few quick definitions to frame our conversation together so that we're clear about that we're using the same language and the same words. When you hear what I'm saying, that you understand how I'm defining it and what it means. So I'll start with the basic definition of health. And I think this is really important because it helps to frame the understanding of why I think community action agencies who are not grounded in only doing health work are super important to advancing health equity. Typically, we tend to think about health as the mere absence of infirmity. So we think about whether we're feeling well and how we're doing in the physical sense. But health is the total and complete well-being, physical and mental and social well-being of individuals and communities. When we look at the chart that's on the right, and many of you have probably seen something like this before, we're in a phase in our society where we're beginning to understand that we've done a disservice when it comes to health because we focused most of our funding and money and spending around health in the clinical care setting, which only accounts for about 20% of healthcare outcomes. When we look at this image, we see that the majority of what is impacting and affecting healthcare outcomes actually exists outside of the four walls of our hospitals and our provider settings. In fact, said differently, over 50% of what really is driving healthcare outcomes is related to the social and economic factors in the environment, as well as the physical environment in which people are living, working, growing, and eventually dying. Over the last decade, we've tried to move the conversation away from one of health disparities to one focused on health inequity. But the two things are really important. And I just want to pause for a second and give a definition and an understanding of why this move has happened in a way, but also why it's important to still understand disparities. So health disparity language, that's what we've been thinking about and talking about for quite a long time, understanding why differences in health status exist between different groups of people. Often we have a reference group, so you'll hear some sort of statistic similar to or close to something like Blacks and Latinos have higher rates of high blood pressure or diabetes than whites. And in that instance, we're looking at the gap between Blacks and or Latinos and whites to understand what's going on in high blood pressure. So again, there's a reference group, if you will, the preferred group in that dynamic is whites who have the better outcomes. Well, here's the challenge with that. We're looking only at the rate of disease. And so if we're talking about a disparity in an issue, then we're trying to fix that disparity. And in a way, we're trying to get those people who are not where we want them to be closer to where the reference group is. Now, you could take this word health disparity and put that in and say education disparity or wealth disparity. You could use any of those. But the point is, we're looking at some reference group that we think has it right or has it better. And we're trying to move people towards that. And sometimes what that can do is make us look at very individual or micro interventions rather than looking at macro system issues. Jokingly, I usually say here, one of the things that disparity language or disparity framing can do is actually give you a perverse way of resolving the problem. Meaning, if we go back to this, Blacks and or Latinos have higher rates of diabetes or high blood pressure than whites, an easy fix to correct that gap is to give more whites diabetes or to have more whites have high blood pressure. But that's in fact not what we're trying to do. What we're really trying to get at is an understanding of what is going on or what's happening. And if you go back to the first slide, when we're talking about the social and economic and environmental aspects, what is happening in the environmental sense where people are living and growing and working that is driving the disparity we see? When we frame it that way and we start to think about the why is this existing, that leads us to understanding health inequity and health equity. Health inequity takes the frame away from looking at the difference between people in a health status to really understanding how do we attribute that difference to external conditions that are not endemic in those people, but that are happening in the environments within they live. So how are we addressing the systematic, avoidable, and just distribution of resources to better understand how we got to the disparity? When we look at it from this frame, it offers us the opportunity to look at those social and environmental contexts to better understand why we're seeing the health status differences that we're seeing, rather than looking at this from an individual or a group individual level. So when we're thinking about health inequity, again, it helps us to understand that disparities that we are seeing are linked to health inequities that are systemic and systematic. Now, we need to have the relationship between health disparities and those numbers and health equity, because in the United States, well, I would dare say, probably in the world, we've never really seen a state of equity or health equity in its true sense. So we need those indicators of disparities that let us know the systemic and systematic changes that we're attempting to make are actually making a difference. But let me stop and go back to what's on this slide. Health inequity, systemic and systematic. This helps us to understand that throughout our whole system, our system is designed to create the outcomes that we are seeing. And in fact, if we want different outcomes, we have to change the systems and how they function in a way to ensure that we get the different outcomes we want. To address health inequity, we have to address the system. We also have to understand that this is systematic. So it's created and enforced in methodical ways through institutional work that we're almost not even aware of that it is happening. Again, that's systematic. And so we have to, in order to address the health inequities we see, we have to also be systematic in addressing it. So we have to understand the systems that are at play, better figure out how they are impacting the health status of people, and then we need to fix, tinker, change, advocate, et cetera, for those changes to make sure that we're moving towards health inequity. So far we've talked about health and understanding what it is. We've understood health disparities and their relationship and difference between health disparities and health inequities. Now I want to move us towards really understanding health equity. So what we've done in a way is moved ourselves backwards to now understanding, well, what is health equity and why are we talking about it? So from the perspective of health equity solutions, health equity is a process, it's a way of being and what we do, as well as an endpoint goal. Now, this is really interesting because it's a one-stop shop that has a three-part definition. When I say it's a process, we actually have to undo a lot of the things that are happening in our society or have happened in our society to actually get to the state of health equity. So we have a process that we need to do. We have to be thoughtful about it, systems and be systematic and systemic about our work. And that's a process, that's a part of a process. We also have to change the way that we are doing things in order to advance health equity. So we have to identify the ways in our society, in our healthcare system, and outside of our healthcare system that we are fostering, or if you will, reinforcing the health inequities that we see. It's also an endpoint goal. So the destination, the journey, the endpoint goal of equity, if you will, is a place where we can actually see, wait a minute, there are changes here. Disparities are not existing in the way that they used to. In fact, we've reduced them or eliminated them. So there's a destination and endpoint of the journey. So I like to look at health equity as a journey. It is a path that we are all on. There's no one map. In fact, on the journey, it's almost like if you remember those books when we were kids that you might have read where it's like, pick your journey, pick your destination, pick your pathway. There are a lot of different ways that we can implement changes in how we do things and who we are and how we work. But fundamentally, the pathway that we get there is going to be different. It's going to be different in every location. It's going to be different for every community action agency. But there are some key tenets and things that we can all practice along the way. That's the process. So you're going to see this image coming up a couple of times because what health equity helps us to understand is we are all not starting at the same place. And I have to share with you all, this is one of my favorite ways of talking about the COVID-19 pandemic. And when I say favorite, I mean, any chance I have the opportunity to, I try to bring in this point about we are not all starting at the same place. All of us are experiencing this global pandemic of COVID-19 together. And early in the process of the pandemic, you would hear people say this is the great equalizer because we're all in this together. But here's the thing, we didn't all start at the same place when the pandemic hit us. Many populations and people already started, and you all know this, so it's almost like I'm preaching to the invisible or visible choir, if you will. Many communities and people did not start off with being economically stable, financially stable, with the food, housing, and resources that they needed. When we're thinking about health, people already had disadvantages with their health status for a variety of reasons. So to think and call this, to say that we're all starting at the same place is actually not a fair descriptor, or that it's the great equalizer. It's not a fair descriptor. What equity helps us do is realize and address the fact that we all aren't at the same place, but we're all trying to get to the same destination. This is why I love this image. I think this image is so impactful and important. It's not impactful if you just view it alone. You've got to take apart all of the different aspects of the image. And I don't have a lot of time today to do that, so I'm going to kind of rush through this, and hopefully I don't shortchange the example here. There are some clear issues that I would say with this image as well. And if we had more time, I would love to get into it. But here's what I'll say really quickly about the image. When we look on the left, equality is what we have been arguing for and looking for a very long time in our society. And you'll note the parallel in this conversation, the move from health disparities to the conversation of health equity, and the move from the state of equality being the best thing to one of equity. But when we look at the picture on the left and we're looking at equality, we see three individuals. I'll leave them ungendered for the moment. I might slip into gender, but I apologize. But we see three individuals who are trying to or attempting to enjoy a game. Now, and you can say that that game represents the game of life. You could say that that game represents health. What we've done is not acknowledge the fact that those three individuals are starting at this fence at different heights. So we give each of them the same resource. The resource is the box to see over the fence. The fence is a barrier. And we're like, that's good enough. That's equality. They all got the exact same thing. Everything is fine. What we're not addressing here is that the person on the left, the furthest left, the tallest person, never needed a box. In fact, if we imagined, and we didn't have the picture on the right, we probably could all see that there's enough distance between the upper torso and the head to figure out that this person probably didn't need a box to see over the barrier, the fence. But instead, we've given this person a box anyway. So when we look to the right, what we see is equity is arguing for us to take the same resources we have, the same three boxes, no new resource has been added. The barrier of the fence still exists. And now we have to distribute those resources differently to accommodate the needs of each person in order to get them to the same endpoint of looking over the fence to see the game and to enjoy the game. I like to look at things differently about these images, and it's all very intentional. You see the body language is really different. Everybody is involved. They all three can see the game. And what's critical here is no one lost a thing. We didn't use our resources unnecessarily by giving everybody the same thing, even when the person didn't need it. We actually took the same resources we had and were very thoughtful about the end goal that we had and how we got each person there. This is exactly what equity does. A frame of equity allows us to use the same resources. And I'm going to pause and say, I keep saying the same resources. Someday, hopefully, we will all have generously be given more resources, but let's stick to what we have right now. And in this image, we have the same exact resources, and we're distributing them differently to address the needs of each person individually to get them to the collective goal. Now, one of the biggest challenges about this image, and if we were doing this in a didactic format where I would have feedback from you all and I would have you go through and walk through this image, I've actually been doing like taking some sidebar research with this. It's not real research, it's not real numbers, but each time I am talking about this image and people give me feedback, I note how many times people actually address the fence. And I have to tell you, 9 out of 10 times people don't address the fence. The fence is a barrier. And it's an important notion to understand that it's a barrier. It's also an important notion to understand that most times people who are engaged in work related to health equity don't see the barrier or they don't address the barrier. And I find this fascinating because what it tells us about who we are in the United States and the way we do this work is that we are so focused on looking at how we get around barriers that oftentimes we don't address the barriers. Now, a few things that I want to say quickly about the image as we go on to talking about health equity. As I mentioned at the start of this, there are plenty of challenges that are at bay with this image. It makes a lot of assumptions that the only resource anybody needs in this is a box to be able to look over the fence. It also makes the assumption that the fence is okay and that it's fine to be there and have that fence be a barrier between the game and the people. There are a lot of things that we can talk about to deconstruct some of the challenges about this image. And in fact, there are other images that have been used to display and depict this exact same point. Ultimately, the takeaway that I want us to have from this again is that oftentimes we are given quote unquote limited resources, and we then deploy those resources in an equality way of giving everybody the same thing, rather than thinking about the different needs that people have and addressing them in that way. So when we talk about health equity and put this into the health frame, health equity is essentially saying we have to give everyone has the opportunity to attain their optimal health, regardless of race, ethnicity, gender, income, or other social factors that create barriers to health. Now, here's something else that I'm going to give you all as listeners today, because there's an evolution, I would say probably in the last week or two, about this definition that we've been pondering at Health Equity Solutions. We as an organization focus very squarely on race and ethnicity as a key barrier to health equity. And then we look at how we look at intersectionality related to that. So we look first at race and ethnicity, and then the intersections in which people show up and have other barriers related to this. One of the challenges, and this definition that you see here is a widely used definition by a number of organizations. One of the challenges that I've been coming to lately about this definition, and will probably be changing how we talk about it soon, is that I feel like it is, exclusionary of people who have disabilities, because I don't believe disabilities are a social factor, and it is a critical context for health equity. So I want to just acknowledge that you're going to start to hear an evolution in how Health Equity Solutions talks about what health equity means as we look at those latter parts, because again, we don't consider or think of disability as a social factor. But again, so the point is, people need to get to their optimal space, their optimal place of health, and that we have barriers in the way that should not be there, that are creating disadvantage in health and getting to health. So as I mentioned, Health Equity Solutions focuses completely on the first point of race and ethnicity for a lot of reasons, and I'm happy to answer in Q&A why we've come to that conclusion if people need to. But for the sake of time, I'm going to go through the presentation as designed to just quickly get to the end point of why we're talking about community action and health equity. The thing is, this image and all of these things talk about the fact and give you the true depiction of, or the difference between equality and equity, but it doesn't address the why. Why aren't we starting at the same place? And for us, that why is squarely focused on structural racism. Now we put here on the slide, you see racism, and I want to start by saying, first and foremost, racism has different forms. There's individual / interpersonal, there's individualized or internalized, there's structural, there's institutional. For us as an organization, when we're talking about why the inequities we see in society are happening, they're rooted to structural and institutional racism. There's a place for all other forms as well, but squarely I'm focused on how structures and systems work together to create the outcomes that we are seeing in terms of inequities. We need to acknowledge first that that's the problem, and then we can go into addressing it. And when we talk about addressing it, the frame of recent thinking about social determinants of health is a way of thinking about how structural and institutional racism has created communities and a society where people have differential access to the social determinants of health. Ooh, I have to quickly go fast. And so SDOH is the conditions in which people are born, grow, live, work, and age that are influencers of health outcomes and really are determinants of how our health status are. You may have seen an image like this before. There are several domains in which the social determinants of health exist. And that, in fact, is why I think we come to the critical point of our conversation today. Each of these domains are spaces in which community action agencies do their work. It's a space in which you are helping to navigate individuals within your communities to get through social and economic barriers that exist in their communities and in their families to get to their best outcomes. For me, this is the key definition about health, because health is not just within the healthcare system. It's all the things in terms of the social determinants that impact and influence that. So when I think about health equity and I think about community action agencies, I think about the important role you play in being community-based and having a trust factor with the people you serve and an understanding of your community in ways that people who are not within the community, policymakers, legislators who are connected to community but not always deeply richly in the community as the agencies are, do not have that access. They don't have that understanding. You're doing the important work of navigating people to social services that are necessary in order for them to sustain the life that they need and their family. And this, again, is all related to health. You're increasing access. The outreach and education that you do empowers community members and empowers the community to have agency and to have agency to do the advocacy and the work they need for themselves and their family to get the resources that they need. And ultimately, this improves the quality of life and leads to better outcomes. When we look at the COVID-19 pandemic, I have been so excited to see the important work and pivotal work that community agencies have done that is connected to health equity. The quick turnaround of using your navigation abilities and your trust factors locally into providing testing opportunities and contact tracing, as well as resource navigation, helping people to find housing and shelter when they need to quarantine, helping to deal with rental assistance programs that different states have put into place, and ultimately assessing the needs of the community in response to COVID-19 and beyond is really critical. All of this, from my perspective, is health, because it all comes back to, are people able to have the physical, social, and emotional well-being needs met in their community setting? So just as a quick review, we tend to think of health in a narrow frame. Health is so much broader than that. All of the work that you do daily is related to the health and well-being of the people you serve. I think you probably knew that beforehand, but I wanted to make sure that I reemphasize this in the conversation today. Health equity requires us to acknowledge that we're not all coming at the same place, and that we can look at this through a multitude of lenses, whether it's race, gender, sexuality, any of the different ways that we can come to this. We can all look at that and resolve the issue of health inequities. And lastly, I believe community action agencies play a critical role in advancing health equity. For anyone who knows me, they know that I believe wholeheartedly in the role of community health workers. And I believe that community action agencies serve as important community health individuals in their communities. And that doesn't mean that you're trying to navigate people from a state of diabetes or a state of chronic conditions. It means that you're attending to the basic needs and the important social service needs of individuals in your community. So with that, I want to say thank you all for making the difference that you make. I want to appreciate you. I want to applaud you for the ability that you have had before COVID-19, but I want to come back and say, I want to applaud you for the ways that you have pivoted your organization, for the ways that you have deployed the people who work for you in order to make your communities better every day. So this is the contact information for Health Equity Solutions. I cannot remember if Deb said that there will be question and answer, but I am going to remain on and I'll turn it back to Deb. Thank you.
Thank you so much, Tekisha. And I hope you will stick around. We're going to spotlight two of our community action leaders from New England, and they will share some information about what their community action agencies are doing, and then we'll have Q&A at the end. So let's put the spotlight now on Rilwan, Feyisitan, and Nicol. Rilwan is the Executive Director of the Community Action Partnership of Providence, where he has worked for the past 8 years. Prior to his tenure there, Rilwan worked at the Rhode Island Department of Health and led the state's efforts on reducing health disparities. He has over 20 years of experience as a consultant with expertise with communities of color, low-income families, senior populations, people with disabilities, LGBTQ+, and more. And Nicol is the Chief Program Officer at Community Teamworks, Inc. in Lowell, Mass. He has a broad and diverse career in social services and began as a co-op student through Northeastern, and taking him now through both public and private sector social services, impacting people in need across the age spectrum. Welcome to both of you. And I think, Rilwan, we're going to have you share some information about your work first.
Good morning, everyone. Also just doing an audio check. Is everyone able to hear me? A thumbs up. Good morning. I'm really privileged to be here with you. I think Cassandra said very astutely during her opening remarks that we're going to spend a couple of minutes today giving you some breadcrumbs. And so I hope that you'll be able to nibble and find your way through this journey with us, looking at health disparities, looking at social determinants of health, and all the other buzzwords that are circulating. I can tell you, and I appreciate Deb, I wasn't aware that she's going to read a lot of my bio, but I've been with the CAPP world for the last 8 years and spent over 15 years in public health, overseeing a lot of those initiatives that she spoke to. So I have a pretty unique perspective, being able to see how government works and how we try to address things from a national level and on a statewide level. And for the last 8 years, I've had the privilege of being able to work on a local municipal level, really being at the ground level of trying to do a lot of amazing work that happens in our community action organizations. That work I did in state government prepared me to bring some of those best practices and parts of things that work well in government into our local agencies. I was able to serve for a long time overseeing the Office of Minority Health, Refugee Health, language access initiatives, and form and staff our first Health Equity Commission for the state. So I had the chance to work with really amazing people in that work, but my most pride that I took in that time was working with what we then called 8 years ago Minority Health Promotion Centers. So we had 35 of those across the state of Rhode Island that were looking at health disparities, that were looking at how they could bring a local perspective at a community-based level to the work that they were doing. They were amazing. They were practitioners before their times, without MPHs and a lot of fancy degrees and titling, but understood community. They were frontline workers, they were promotors, they were health navigators, they were community health workers before the titles became nuanced. The other thing that was amazing about them is, and that network of providers, just like our CAP agencies, we know our community. We know what resources are available generally, and we know how to apply them in a really amazing ways. Part of the work that we need to continue to do in that work is our assessment, our data work. So if you're in the CAP world, speaking again to the choir, you know that we need to do annual or biannual assessments. It's what separates us from other nonprofits. Part of what gives us our designation is this ability to go and do really high level assessment and bring those resources and be able to pivot really quickly to meet the needs of our communities. And that's what I love about community action. I love about the work that we do. When I worked on the state level, the work was challenging. It was amazing to be able to look at statewide opportunities to address some of these major systems issues. But there was nothing better than coming back to the community level and being able to see the fruits of that work, being in the trenches with people, being able to hear what those needs are in real time and not just look at them as longitudinal studies that we often did when we were in government. Community action workers at every levels are heroes in the faith. We have first responders that do amazing work, as we all know, our firefighters, first responders, but you know, if you're in community action work, we are essential workers. We're at the food pantries, we're frontline, we're working with people that are COVID positive. We do all of those things that are incredibly needed and would not be able to function if we were not here. So how does this tie into our session this morning and the words that I wanted to bring to you? I say this to you, we are all extremely busy. Many of us are tired. We're hitting those walls of COVID fatigue over the last 9 months, and we know what's ahead of us as we move forward. I'm actually going to make an appeal earlier than the 15 minutes at the end of the session. While we are busy and while we're tired, I really ask you to dig in and look at our data and look at our assessment work. So it doesn't need to be in one of our annual or biannual years where we look to do that. This issue of health disparities and inequalities ties back to data. It's rooted in what our assessment work truly is if we're doing it and we're doing it at a high level. Never in my life, I mind you, in my 20 years of work would I be thinking I'd be doing a speaking portion on data. I am at my core a program person. I love getting out and doing program and getting my hands dirty and rolling up my sleeves, and many of you are those kind of people. So we say in life, there are generally two kinds of people. There are planners and there are doers. Very few of us are both. But we have to be able to do the planning if we're going to do the doing. So what am I saying by that? One of the things that my agency is really aware is of our assessment and how we impact the community. So if we say we're about community, we really need to understand our community. What we took time to do over the last 2 months is to do some real hard needs assessment. So right after Halloween, we put out a needs assessment to a subset of our population. I'm the executive director in Providence, Rhode Island at Community Action Partnership of Providence County. We serve 33,000 residents in Providence alone. And so we heard all of the grumblings and the pushback, even from staff, that we're in the middle of COVID. How do we have time to be doing needs assessment? How do we have time to figure out all of the things that are going on in the middle of the pandemic when we're stretched so thin and we're doing so much? And we kept pushing back and we kept saying it's more critical than ever that we're doing the assessment work if we really need and want to know what's happening in our community. So we took out a really ambitious plan of sending out a subset of our 33,000. We sent out 6,000 mailers to a subset of our population. And what I want to tell you is within the first 2 weeks of sending out those mailers, we had over 1,000 respondents come back in. So 1,000 of our residents in the middle of COVID responded back to our needs assessment and our survey to ask what their needs were. We wanted to know very clearly what were they seeing in real time, what were the needs, what were the barriers, what were the things that they were seeing on the ground level that were impacting them. But more importantly, as a leader in understanding emergency preparedness and kind of this long-term look at the work that we do, I also wanted to know and put questions in that when we get to the recovery, we know we're not there. If you saw national news over the last 2 days, Rhode Island is now the epicenter for positivity in the country. So the live news with Gail King and everyone else were at our convention center, our field hospital that were opened up. But what we said to our staff and we said to our community is, we don't have the time not to know specifically what's going on. Those 1,000 assessment plus, and they're still coming in, have been invaluable to the work that we're doing here, because we will at some point get to a recovery phase. And what we also asked of those individuals and those 1,000 plus were, what do you need from your local community action agency when we get to the recovery phase? What are you going to expect from us to provide and be able to give you once things get back to whatever normalcy is at that point? We're using all of that real-time data right now to also be as impactful as possible during our response. but it's also going to be able to give us that information that we need in the recovery phase. So I say to my brethren in the community action world, I know we're tired, I know it's daunting, but you've got to roll up your sleeves and do the work. You've got to hear from your communities, you've got to understand what's going on. I think we were primed for that early on in the pandemic, because like many of you, we were in the middle of census. It seems like eon ago as it's finally closed, but we understood the importance of the count. We understood the importance of making sure that everyone in our population were there, because it tied into our funding and our ability to provide adequate services that are important, right down to congressional seats. But there are other parts to the work that I'm imploring you to think about, and how the data is important. We all know inequality. We also know the systematic issues that are there. If I throw out the term Tuskegee, every one of you would nod in agreement and understand. They already started right away. From the faces that I can see in the panel. Tuskegee cannot be our endpoint. It's got to be the beginning point of where we addressed systematic issues of inequality, oppression, of bias, all the issues that went into that study that we know so well that I don't have time to get into the story, but you know well. When we look at the current environment we are, and we look at the vaccines and the trials that are going on, we've got to be able to feel comfortable or force our way to make sure that they're accessible to communities that are underserved and that are marginalized. There's a reason why so many in our communities fear or are hesitant to take vaccines. It started at Tuskegee and many others, more than just Tuskegee, but it can't be our endpoint. So how do we impact that on a community level? We don't all have access to Pfizer, Moderna's trial and all the data that we hear that's going to be putting out. But many of you, if you're like me, have served on institutional review boards. Those are panels that talk about human research and talk about trials to make sure that there's efficacy, to make sure that there is true adherence to safety of communities and those that are marginalized. We've got to be able to look and figure out, even from our narrow lanes with broad dimensions of work that we do in community action, how do we get into policy? How do we make sure that our folks that are the most need, most vulnerable, are going to have access to things like vaccinations during the COVID time? We also need to really push hard and look at how we frame things. So often we talk about medicine, or we talk about health, which I was there for 15 years in public health, as pills and bottles and providers. Our presenter showed us the diagram. Health is so small of that pie chart. The actual doctor visit, the actual nurse practitioner visit, the actual distributing of medicines. That work happens in our community centers. It happens in our homes. It's being able to understand what's happening, being able to advocate for our families and ourselves about what we need in medicine. One of the things that I'm really passionate about in our work at CAPP has been around food insecurity. We went and were serving with the largest food pantry in the city of Providence. During the height, we, like many of you, were seeing over 1,000 people a month come through our doors for food and support. We overnight became a Meals on Wheels program, and that system hit capacity in our state. We're now serving over 1,000 meals a month to our seniors at their homes. So we've pivoted and we've looked and we've moved at how to adjust. But one of the things that we're connected to that work is because we look at food as medicine. We don't just look at the amount of bags that we're handing out. We don't just do the bean counting and the check off back to our CSBG reports and to our funders and said that we gave out X amount of food. That's good and it's needed. But what are we doing to change the need for food insecurity in our states, in our programs, in our cities? What are we doing to get people into our education and job training programs so that they don't need to be in our programs? We have so many reactionary programs that are amazing, that are national models, but I got into this work not to be another reactionary program collecting data. I got into this work because I wanted to move that needle and move people from insufficient opportunities to a place of dignity. We have a mantra here, serving with dignity, leading with purpose, that talks about how we want to get people to where they need to be. So when I think about food as medicine and the time, Kelly will give me that thumbs up, my timer hasn't gone off. Think about those things in our community that are more than just bags and bean counting. How do we really get deeper? And part of that's gonna come through your data that's gonna tell that story. So with that, I'll pause and thank you for giving me a couple of minutes to give some breadcrumbs for our discussion later.
Thank you, Rilwan. And we'll move to Michael.
Well, thank you all. My name is Michael Collins. Once again, I'm the Chief Program Officer at Community Teamwork. and I have the unenviable task of following Dr. Everette and Rilwan, and I'm sure I'm not going to be anywhere near as eloquent as they have, but to just tell you a little bit about the work that Community Teamwork has been doing. And we are the second largest community action agency in the Commonwealth. And in addition to being a community action agency, we are also a regional housing agency. So we operate the Section 8 voucher program. We provide family shelters. We've been, in recent years, getting involved with the issue of youth homelessness. And just this past weekend, we helped to get 37 individuals off the streets of Lowell who were homeless into hotels as part of an emergency response to the individual homelessness issue. But our work in the area of health has been rooted, I think, in many ways in our longstanding connections with the community health center movement. And I'm sure many of you know that the community health centers were basically created around the same time that the community action programs were created in the 60s. And we've had a strong and vibrant relationship with the Lowell Community Health Center for a long time. And in particular, in the past number of years, we have worked with them to begin to understand social determinants of health issues. And some of you maybe are involved or have been involved with the community health needs assessment process that takes place in your communities. The Greater Lowell Health Alliance does that for Lowell and the surrounding communities, and they use that to develop a community health improvement plan, which basically informs the way that funding is provided through something called the determination of need process. And I won't go into too far in the detail of that. But they do their assessment. We do, of course, our community needs assessment as a CAPP agency. And one of the things that has begun to occur, of course, is that even though we are looking at this through a different lens, they through the lens of health and us through the lens of, overall community needs, economic issues, housing, food, employment needs, and so on, that there's a remarkable synergy, of course, between what they find with their survey process and what we find with ours. In particular, the issue of housing and affordable housing. Lowell is a community that has a very low vacancy rate, and even though it's a community of immigrants that has, a fair amount of substandard housing, it's also an area that has grown rapidly, particularly with the University of Massachusetts Lowell there, so that the vacancy rate is extremely low, and finding affordable housing in particular is a challenge. So we have tried to put a focus in particular, I would say, on the housing issue. Back in October of 2017, we engaged the community in what we call the community conversation that was titled, "What Does Housing Have to Do with Healthcare?" And we put together a panel that included the Deputy Director of Children's Health Watch, David Turcott, who is a professor at the University of Massachusetts of Lowell, and runs something called the New England Homes Training Center, the Chief Medical Officer from the Lowell Community Health Center, who we have had a long relationship with, providing pediatric and adolescent care, and our own Carl Howell, who's the Deputy Division Director for our Housing and Homeless Services Division, to begin to look at the health impacts on families and children in particular who either were homeless or had inadequate housing. And that really began a process of us continuing to raise the issue of the need for additional housing. And we have been engaged with a number of statewide organizations. I know Joe is on this call, but in Massachusetts, we've had the development of something called accountable care organizations, which is part of Medicaid, mass health reform. And there is something called a district waiver, which basically allows those accountable care organizations to engage with community-based organizations to provide social services supports, housing supports, food supports, because, as Rilwan said, healthcare is not just pills and diagnostic tests. It is really attending to those really basic human needs. And so we have been fortunate to be designated as a community partner with 2 accountable care organizations. And the truth is, we are not really breaking down barriers. We are addressing, the effects of inadequate access and of, inequities that have persisted for a long time. But at least we are in the discussion with the healthcare community who are beginning to see the value of that. The Lowell General Hospital has basically provided funding to us over the past couple of years through what is called their community benefits funding, to have our staff, who are really fundamentally, and I've had this discussion with folks locally, they're really community health workers. And they are at the the emergency rooms at the hospital, so that when folks come in and their medical issues have been resolved, but they have no place to go, and they need housing, and they need employment assistance, and they may need, immediate needs of, food, shelter, and so on, that we have staff there that basically are doing triaging with folks from the healthcare system to try to provide for those immediate needs, and then to develop a plan to try to create some long-term housing security and economic security for them. The other thing that we have begun to do is as part of our needs assessment, and Rilwan mentioned data a couple of times, is to have an intentional analysis of that data, looking at through the lens of racial inequities. Kelly, can you pull up the next slide? Kelly? Okay.
Yep, just give me 1 second.
Okay.
Thanks.
This is the challenge of technology. And I have these headphones on because I'm working at home today and there's work going on outside and I can't hear everyone well if I have that on. So this is part of our community survey in 2020. We basically looked at this data through the lens of the disparate responses of white non-Hispanic members of our community versus Blacks and Indigenous people of color. And you can see, and particularly in terms of are you able to pay your bills on time? Do you have $500 set aside for emergencies and so on? How significant that, level of inequity is. And on the next slide, we have also taken a look once again at the home ownership issue. And this is the breakdown by population in our community of white non-Hispanics and the minority communities. And you can see that the percentage, of course, of home ownership is much lower in those communities, and the renters are much higher. And the average rent continues to go up. I think a 2-family apartment in Lowell is now, a minimum of, I want to say $1,500 or $1,600 a month, and as high as $2,000 a month. And so we really struggle with finding housing that we can provide to folks who really desperately need it. And I guess I would just, close with Dr. Everette mentioned earlier that, racism, of course, being a core factor in lots of this inequity. And over the past several months, as we have continued to respond to the pandemic, and I will say just a couple of words about that when I am concluding. But we, along with other members of the community, were involved in an effort to try to have the city council declare racism as a public health crisis. Our executive CEO, Karen Frederick, who some of you may have connected with yesterday, and Carl Howell and others, gave testimony at a city council hearing that went on until the late evening hours, if not early morning hours. and the resolution failed by a vote of 5-4. And the kind of a watered down version did pass, by a vote of 6-3. And it was clear that, of course, it was a challenge, frankly, for the largely white members of that city council to accept this as a reality. And we provided data to them to try to drive this home, which we showed to the mayor. And I think there's one more slide you can pull up, Kelly. No, maybe not. Okay, so this is the data that we presented to the mayor of the city, who's a member of the city council, but it's a city manager form of government. So that the mayor, certainly an important leader in the community, but is not the chief executive, but influential in the city council. And we were involved along with the community health center in presenting this information to the city council to try to persuade them of the fact that racism is in fact a public health crisis. And we have continued to be involved in this effort. The Lowell has developed a diversity, equity, and inclusion committee that involves leaders from various nonprofits, members of the community representing various community groups, and continue to engage as in this discussion. I think that not much candidly has been done. From the perspective of what the council said they would do, acting on the less strong statement. But we continue to ask them why and what's going to happen next and what specific actions are you going to take. We've also taken steps within our own agency to create a racial justice task force, which involves members of our staff as well as members from our board of directors. And so we're continuing to look at the inequities that we really need to respond to, both internally within the agency and within the community, while at the same time being involved in responding to the pandemic. We are administering a rental assistance program called RAFT, which is Rental Assistance for Families in Transition, which is an effort to try to keep people from facing eviction and becoming homeless. And of course, a large number of those folks, not exclusively, certainly, it affects everyone across all racial and ethnic groups, but a lot of the folks who are facing those ill effects of the eviction process are certainly from the minority community. And so we are administering that program. We have our child care centers are operating, but we are beginning to see, community transmission of COVID, which requires us on a regular basis to make decisions about which classrooms we need to close down and how can we keep our staff safe, keep our families safe, and still provide educational supports to children and families. So a lot of what we're doing, I think, of course, feels like it is reacting to both crises, both the crisis of the pandemic as well as the crisis of racism. As Rilwan said, the staff, particularly the staff who are doing the hard work every day of interacting with children, interacting with clients in shelters, are exhausted. We try to engage with them on an ongoing basis as best we can. But it is work that is taking its toll on the community and taking its toll on all of the folks who work for us, who are trying to do this hard work every day. So I will end there. Thank you very much.
Thank you. Thank you so much, Michael and Rilwan and Tekisha. And we're going to bring you all back up as a spotlight. And we've gotten some questions in the chat box. And don't forget, if you'd rather raise your hand, we can do that and unmute you as well. But one I wanted to bring up, Tekisha, you were speaking and showing the picture of the kids watching the game, standing on the boxes. Mary McAllister from one of our community action agencies here in Connecticut wrote into the chat box, how does the short person get up on the box and access those resources? Can they access the resource, or are there other unidentified barriers? Do they even know the boxes exist? So those were some insights that Mary provided that made me think about the variety of different programs and services that our state and federal governments have set up, our local governments have set up, and whether people even know about them in the community and what those barriers are to accessing them. And I'm wondering if the three of you can very briefly comment on that thought, and then we'll take it from there.
Well, I'll briefly just say, I think that's the role that community action agencies play, and that people who serve as community health workers in the community play, and making sure that people know resources are available, how to access them, and to give them the hand up, the lift up, the whatever they need to get to the resource. I have a master's in public administration, so I studied bureaucracy. And one of the things that I find interesting about government is that it simultaneously has the role to benefit and help the people, but also contain and control costs, which those two things can be at odds with each other. So in a quick example of that, you want people to have healthcare access that's paid for by the government, i.e. Medicaid, but at the same time, you need to control and constrain your budget. That doesn't mean that everybody who's eligible is always, it doesn't mean that it's in your best interest as the bureaucrat who's administering that program to get everybody who is eligible into that. That's why you need community people who understand, and community agencies who understand the need, who navigate people to the need, despite that, taking it out of the responsibility of the bureaucrat who, if you will, who has to protect the program, and putting it into the hands of the people who have to protect the people.
I guess what I would say is not to oversimplify it. I've seen it in the chats, and what we use with our staff is those same slides with equity and equality, but there's a third one that we also use that says liberation. So really the work is in taking down those fences. It's not allowing someone to have to climb on those boxes. It's taking away those systematic barriers that are in place many times intentionally. So oversimplified, I know, but it's not about giving another support or another accommodation. It's about getting rid of those larger barriers altogether so that everyone has an equal playing field.
Nice. Thank you. Are there other questions that I'm just checking for raised hands? Not seeing any raised hands. I know, Tekisha, you answered this one already, but just for everyone else's benefit, Tim Johnston typed in a question about the tension between equity and fairness, and how employers tend to try to provide the same for all their employees because that seems fair. Policymakers try to approach programs in that same way, and then the results are not as great because the resources are not going to where they need to go. So how do we change people's minds and hearts about what's fair versus what's needed to ensure that all of our neighbors have the same opportunity to excel and the same resources, or the resources that they need to get to the same place?
So Tim and I ended up having a very robust discussion offline, and I'm not going to go all into the details of it, but here's the thing that I will share as the highlights from the conversation. We have to get out of the typical mindset we've had where we've confused privileges with rights, and thinking that the right thing to do is to give everybody the same resource. The right thing to do is to really understand what the needs are of people, have a transparent process that addresses the needs for people differently. And so one of the examples that I put into the chat, and I'll elevate here, it's outside of the conversation of health, but it's really thinking about your role as an employer and what this looks like. And we are examining these same things as an organization, just so that we're all on the same page. We're not perfect, but we tend to do this thing like having a leave policy that's equal for everybody. Everybody gets 2 weeks of leave, whatever it looks like, regardless of what your individual needs may be. Some people will never use those two weeks. Some people have to use more than those 2 weeks. Creating a pooling pooling opportunity or some sort of process where you're saying, hey, this is what we have available as an agency completely for leave. And people can take leave as they need it, and they can access additional leave if they need it by applying to this pool through this transparent process. And then at the end of the year, being able to report, we helped X amount of people to take care of their family, to do the things that they needed because we had this transparent process in place, allows people to feel excited about the fact that everybody didn't get everything the same way, but they all had the same access to it. They all had the same ability to have those things, and they were able to help everybody else. We just have to get out of this notion of saying we have to take everything that's available to us rather than taking what's necessary for us and what we need, and get out of the thinking of that in terms, if we go back to that box, that we took something away from the tall person. That's something that I constantly try to get back to. They never needed it. And it's actually poor resource allocation to give people things they don't need. That's why we have the scarcity mindset in the United States. We don't have scarce resources. We keep misaligning them to the need that's out there and keep misusing them. Okay, I'm starting to get preachy. Let me stop. But
Okay.
that's
Thank you.
the way we went through that.
So I really want to thank all of you for sharing your wisdom with us today and your insight. And I hope that all of us who have been watching and participating this morning have already primed our brains and our hearts for incorporating some of what we've learned today into our actions moving forward. Just to wrap up, we did have a suggestion that the network collaborate to form sort of a playbook for future crisis response across our network. And so that's something we can talk about offline, incorporating some of the concepts that you all raised. Rilwan, the importance of doing a community needs assessment, even when you feel like, how can we possibly take the time to do this right now? Michael, the importance of sharing your data with policymakers. And Tekisha, I know you would say the importance of sharing stories along with those data points to really help people understand how their friends, their neighbors, their family members are impacted by those things. So thank you so much again. We really appreciate it. This has been recorded, so we'll have an opportunity to watch it again if you'd like. We're going to go on break now. We'll start back up at 11 o'clock. So feel free to get up, stretch, take care of anything you need to do, and we'll see you back here at 11. Thank you.
Thank you.
At Mutual of America Financial Group, we believe people make the difference. For 75 years, we've been dedicated to providing premier retirement services to the nonprofit organizations that make our country and the world a better place. We are here for you. Mutual of America Financial Group, retirement services and investments. At Mutual of America Financial Group, we believe people make the difference. For 75 years, we've been dedicated to providing premier retirement services to the nonprofit organizations that make our country and the world a better place. We are here for you. Mutual of America Financial Group, Retirement Services and Investments.
Welcome back, everyone. I hope you had a refreshing 12 minutes or so, and I'm excited to get us back on track with our agenda for our next session. And I'm going to turn things over to Dietza Wooden-Wade to get us, to introduce us to the session. Dietza is an assistant manager of community services programs in the Division of Community Services at the Massachusetts Department of Housing and Community Development. And she's also a member of our planning team for this symposium. Welcome, Dietza.
Good morning, everyone. I just want to say that the last 2 days have been really exciting and engaged, and as well informative to where we can all then start to walk away and start thinking about how we can take what has been a worldwide event and during this pandemic and turn it to where we can actually start to look at our own policies and processes and programs and start to affect change that will have a positive impact to the communities that we serve. Today, I have the pleasure of being able to introduce two speakers that I had, both Cassie and myself had heard at the National Association of State Community Services Programs. And it was on the digital divide. And both of these individuals, as you will hear shortly, have quite an extensive background and have been engaged in this whole arena of the digital divide. And quite honestly, for myself, it's been a new term, a relatively new term that I only started to realize as we were into the pandemic. So I'm going to stop talking, and I would like to first introduce to you Antwuan Wallace. He's focused on racial equity, and he is a public policy researcher by training, focused on equitable systems design and systems transformation, creating knowledge on laissez-faire, local, state, and federal governance, attending market failures and how the unintended consequences of public policy materially impact low-income, working families, and no-income, work-seeking families. A social justice organizer by choice, he provides thought leadership in evaluation, research, and design. Antwuan is a Robert Wood Johnson Health Policy Fellow with an impressive, extensive academic background with graduate certificates from the University of Michigan, Ann Arbor, Institute of Survey Research, and City University of New York Institute for Demographic Research. He has completed doctoral studies in comparative social welfare policy at the City University of New York Graduate Center. Finally, one of the things I did want to make note regarding Antwuan was that in talking with Cassie and myself, he had informed us that his grandmother ran a Head Start center in Florida. So community action, he does know. And in fact, he is a product of Head Start. And one of his mentors who has stayed with him throughout his academic and professional life was his teacher from Head Start. Antwuan is a research faculty member on leave from the Maryland Institute for Contemporary School and sought after thought partner in US broadband. And I do want to welcome Antwuan. Now, I'm not sure if someone can give me the thumbs up or something, if Nicol Turner-Lee has joined us yet. She's literally leaving one event where she has. Okay, great, awesome. Dr. Nicol Turner-Lee is literally engaged at some of the highest levels of the digital divide conversation. Good morning, Dr. Nicol. She is a senior fellow in governance studies at the Brookings Institution, the director of the Center for Technology Innovation, and serves as co-editor-in-chief of Tech Tank. Dr. Turner-Lee researches public policy designed to enable equity access to technology across the US and to harness its powers to create change in communities across the world. She is an expert on topics that include online privacy, 5G networks, artificial intelligence, and the digital divide. Her work also explores global and domestic broadband deployment and internet governance issues. She's an expert on the intersection of race, wealth, and technology within the context of civic engagement, criminal justice, and economic development. Dr. Turner-Lee has her forthcoming book on the US digital divide titled Digitally Invisible: How the Internet is Creating the New Underclass. This is forthcoming in 2021 under the Brookings Press. She sits on various US federal agency and civil society boards. Dr. Turner-Lee has a PhD and MA from Northwestern University and graduated from Colgate University. I am very proud to introduce to our symposium attendees two very impressive and engaged individuals. And I'm going to pass it over to Antwuan to kick it off.
Well, thank you so much for that generous introduction, but I'm always happy to be talking to my friend, Nicol. We go way back in this work, right? I think before we had all these accolades and degrees, right? Working in community, right? Trying to work in community and understand this thing that I want to take us back, Nicol, like to the late 90s, right? In the formative understanding, because I think Ditz's question about like just hearing about the digital divide needs to be placed into a context. And I think it may be helpful for the people on this call to really appreciate like how long this work and this policy issue has been in place. But I would also want to ground this inside of the conversation around CAA. I am I am a Head Start graduate, and I any success that I have, I share it with Jean Rigby, who was my Head Start teacher, and told me that when I got off to big school, which was going to be kindergarten, that I could be anything that I wanted to be in the world. And so I'm happy to honor him and his legacy in my life. But I also want to honor CAA.
I think Antwuan, oh, now you're back.
Okay, are you losing me? Okay.
We can hear you now.
Herein lies one of these, these questions about what actually is broadband when you're paying these prices for broadband for a T1 line at a residential location. But putting CAA into a context, right, to solve issues of poverty under the war on poverty out of Johnson, places, I think, the digital divide and this question of divide in its appropriate context for this conversation, which is to say, there are people for whom the economy and the construction of opportunity, right, is a bit more tenuous and has some structural barriers that folk have to overcome. And so in the context of the work of the people who are on this call, I think a good place to start to think about the digital divide is rooted historically in questions of residential segregation, disproportionately Black folk, brown folk, now also rural. There's this rural question, there's this central city question, and this question about, well, what actually is broadband, right? And what qualifies as broadband? And I think the definition of broadband as set out by the FCC is a good place to start, the Federal Communications Agency, that suggests to us that 5 megabits upload is the standard for broadband, and broadband separate from a question of what is actually Wi-Fi. And so I just want to distinguish those two things, right? Wi-Fi is the thing that is this wireless connection. Broadband is that hardwire pipe to your home or to your job that provides that connection. I think, Nicol, your work has been centered around this research. And I'm hopeful if you could just talk to us a little bit about both your book and your work at Brookings and why the need for a national platform around this work.
Thank you, Antwuan. And he's right. You saw in the chat, I had to actually try to get him before he started revealing how old I was. Because when you say to somebody, you go way back, and you start going back in the thousands, you know. My mama told me you don't tell anybody your age. Well, first and foremost, before I jump into Antwuan's question, I want to thank this organization for having me. I'm really excited about the opportunities that we have both been given to talk to groups where the digital divide is not necessarily something that you focus on every day. And it's important as we actually look at what has happened with this pandemic, where all of us on this call have pretty much been required, as well as our family members and friends and neighbors, to social distance. Being online in 2020 has mattered. In fact, I'll start my book like that. It was written actually before the pandemic. I went around the country, about 7 cities, to actually ask people about their internet access. And in that last visit that I did to Marion, Alabama, the pandemic hit. And now we have actually all been heavily reliant upon the digital ecosystem to basically drive everything from how we live in terms of our groceries. My 70-plus-year-old mother now is an Instacart fan, whereas before she would have never done that. We now use technology for our health provider. Many of us now leverage those remote health visits to pretty much do everything because of our fear of either going into a hospital or into a clinic or a medical provider's office. And we also are looking at these new tools for work-based stuff. Look at what we're doing today. Look at what I just did for the first time with some family in Detroit in terms of a Zoom reunion. Look at how some of us celebrated Thanksgiving, where we all had our dinners and we use these technologies to connect. We on this call are in the fortunate position because we don't stand on the other side of the digital divide. My book that Antwuan is talking about comes out of years of working in communities in what was called the Community Tech Center movement, where we actually received a lot of funds from the CDGB program, as well as other social service programs to credential low-income people to break the trajectory of poverty. At that time, we were teaching things like A+ certification, Microsoft Office certification, doing job training within tech centers when during that period, you could only apply for a government service job online. Some of you all know what I'm talking about. The TSA jobs in the early 2000s went online, and you had tons of people trying to figure out how to create a real resume and how to actually use these boxes that are now commonplace to input their information. But back then, and this is to Antwuan's question to me, the internet and being online was very binary. We dealt with who had a computer, who didn't, who had access, who didn't. And it was one of those things that we could fill in the gaps on the either or side. Today, if you don't have a computer and you don't have a phone and you don't have broadband internet access, and guess what? And you don't have a credit card or any type of debit or financial collateral, you are not participating in this new economy. Point blank, period, mic dropped. Because you cannot get those things without being fully engaged on all of these other levels. And I think that's why when I talk to groups like yours and associations like yours, in many respects, you are also heroes and sheroes in this movement to make sure people in this country stay stable and they stay visible. And that's why the book is entitled Digitally Invisible, because we have created, like Michael Harrington said in The Other America, another America that sits on the wrong side of opportunity, but they often are people that we don't even know exist because there's no information that's being collected around people's digital use. I'll give you one last short story and then I'll pass it back to Antwuan. In my book, when I go to different places, I went to a place called Garrett County, Maryland. It's about 3 hours outside of Washington, D.C. It's a very, very, the topography is vast. I'm a city girl. I grew up in New York. I grew up in New Rochelle, New York. There's more cows than people. And I was a little nervous going at night because there were no street lights. And my GPS kept knocking out. So I kept having to go back to the nearest city to get 4 bars of my phone because I did not know where I was going to land up. But one thing that the social service agency said that I think will be poignant to this discussion, before the pandemic, and again, I want to put this in statistics, 18 million people offline. Just keep that in your head. Before the pandemic in rural America, the majority offline. Social service providers, case managers had to drive 2 hours to a client's home in rural America just to check on them. 2 hours. And by the time they drive the 2 hours, because that family did not have broadband internet access, they had to drive 2 hours back to the office. And what they explained to me, by the time they actually were able to provide the service or to check on wellness or connect them to food or other types of social service supports, it was now a month out because of the lack of broadband access. To me, and this is something I said yesterday at a conference, we must figure out how to leverage technology, my friends, to not only close the digital divide, but to create a 21st century social service delivery model that cuts out the waste, that ultimately contributes to the trajectories of poverty that continue to maintain the invisibility of people. And so I'll stop there for a minute, Antwuan, because I know we're tag teaming it, because you know I can keep going on. I'm sorry, everybody. I'm like a Black Baptist preacher. You give me a microphone and the stage, and I'm not going to stop. This is my life. This is what we do. But I'll turn it back to Antwuan, because I know as we talk through this, there's other relevant learnings.
Yeah, I think you placed this right into the context. I want to make sure that we are guiding this conversation, because I do think the way in which we think about social service provision, and we think about and we think about the divisions of provision, right? There's government, there's private, and there's public. It's a way to also think about the way that we've kind of thought about these roles of broadband, and the interconnection of those things are often disconnected. And I want to connect those across this conversation. When we think about the role of CAA and the role of broadband, the question that comes up is who's online and who's not online and why, right? When we talk about, and I want to talk a little bit about just good data sources for folk to appreciate where they could find out some of these questions. And if they can't find out some of these questions and answers, like what are some of their opportunities inside of their own work? Now, Nicol, you and I have, trained as researchers, are often referring to literature, right? And so when we talk about these 18 million people offline, sometimes they're classified as non-adopters, and right, people don't want to adopt technology. And quite often the research has been distilled and broken down. And right now the question is either relevance and price and place where you live, right? When we think about those questions, in your work, can you say a little bit more for this audience about what you were able to find as it related to being able to afford broadband and what that meant for the people that you were able to interview?
Yeah, I would like to say to this group, first and foremost, I would love for you all to start thinking about broadband, not as the federal government has, which is, there are these 5 existential threats that we're going to have to deal with as a country. The first threat is obviously the pandemic. The second threat is obviously healthcare. The third threat is the economy, and potentially the fourth threat is going to be education. But what happens with broadband is it becomes part of another list. It is more so looked at as a commercialized product. Well, who's going to have a phone so that your kids can do interactive gaming? Or how do you have a phone so you can order airline tickets? But what we're seeing, and I think, Antwuan, you're completely correct in your assessment of this data, is that not being connected overlays with the variety of systemic inequalities that are affecting low-income populations. Food insecurities, housing insecurities, broadband insecurities. And let me tell you what that means. So on my research, for example, I went out to Stanton, Virginia, and there was a young African-American guy, 4th generation, that lived in this home, who was a day laborer. He ran out of minutes on his phone halfway through the month, and as a result was unemployed for half of the month. In fact, someone read my article and wanted to provide him and his fiance, which I later found out they broke up because I went back and tried to find him. Because guess what? His phone went off. And I had to go back to the home, knock on the door to tell his mother that somebody wanted to give him a laptop for his kids. And guess what the mother told me? Well, I don't know how to get in touch with him because his phone is off. Now, I know I'm speaking to somebody out there who has actually seen this trail of communication that actually is emboldened when we have people who lack the means to stay in touch with us. And that's why I think we've traditionally seen broadband as this pie in the sky. If you have it, what a privilege. When I was growing up, people who used to have the most technology were doctors. If you all remember, they had those car phones where they carried in those bags. And then later they used to have those real sophisticated phones. I just had a beeper at the time. I was in graduate school, all I had was a beeper. The only communication that came through was a 911, which meant to call my mother on the payphone. What I'm suggesting today, that was okay then, but now we're in a society where everything is broadcast in real time. And it's even more so important, and this is a sensitivity that I like to bring to this group, that not only our constituents are connected, but your case managers are connected. Do you know in the case of school that there were 50 million kids sent home at the end of March or the beginning of March? Out of the 50 million K through 12 public kids schools children, 15 to 16 million of them did not have broadband access at home or a device. 9 million did not have either. They also went to schools where their educators didn't have broadband access. And so what we began to see, which at first I thought was kind of cute, but it became very demeaning, is that these kids were walking to Taco Bell, McDonald's, and the parking lots of libraries to do their work. And we later found out so were their teachers. We take for granted in this society that broadband sits alone in a vacuum, when what I would love to impress upon you all in the work that you do, that having a connection also ties to poverty. The more that you have to choose between broadband and bread, the less likely you are, as data suggested, to maintain a consistent connection. So again, go back to the pandemic. 100,000 businesses closed. Frontline workers who have to work and continue to work with a higher susceptibility of the disease, mostly people of color. And after the expiration of the CARES Act and the housing assistance, we will have more transient families in this country than ever before. How are we connecting them? What role are we playing to create the levers to know how they communicate with various actors in public welfare institutions? I'll throw out a trick question. Do any of you actually know who is the service provider, or if any of your clients or constituents actually have broadband at the home? I can tell you this, thousands of school superintendents across the country never asked their students if they had home broadband. And so as a result, I had two superintendents on a conference last week or 2 weeks ago, Hartford, Connecticut, and Reynolds, Oregon, state of Alabama. They don't know where their kids are. And so I share that with all of you. This connectivity is no longer around privilege. It is now the utility of purpose, to Antoine's question. And we have to move these barriers out of the way so that we can ensure universal service, not just to the constituents that we serve, but to the providers of the services that we administer that are there to improve quality of life.
Nicole, I think that's a perfect point. Some of the work that I'm doing is very similar to that, right? And thinking through some of this research project that I'm finishing up in Massachusetts, looking at root causes of homelessness for youth and young adults in YABS, and the role of HMIS, the homeless management service system, right? Many of those youth are now untrackable, right? They're a loss. But what we're finding also, so I want to have a balanced conversation, not that we aren't, but I want to have about the strength-based approach is that what we're finding is we're able to find those young people when they are connected to community colleges, right? When they are able to connect to places around social economic status proxies. Do they have an advocate? Do they have someone to do that, to be there to help them navigate through the systems in order to stay connected? I want to unwind that a little bit and talk about at the beginning of it, right?
Yes.
What we're looking at in terms of the loss across the entire economy for our children, particularly the most vulnerable children who are in Head Start, right? And particularly as we're starting to try to level the playing field for the start of education foundations, we're just now starting to see a research agenda and to see data, right, that emerge on how, unfortunately, how well our children aren't doing and what the losses are. Could you say a little bit more about, inside of your research, what you've been able to look at, and then I'll come back with some of the work that we're doing.
Well, I think in all fairness, I have to be honest, I am so like exhausted, folks, because this is all I do every day. Outside of the fact that I'm a parent of a 14-year-old that half the time I don't even know what she's doing. So if I don't know what my own child is doing because I'm sitting on these things, I know what it's like to be in a household where your two parents are working as I was growing up, and you are now the oldest child trying to figure out how to get your sibling on an online a lesson. It's tough. And as you said, McKinsey said that Black kids are going to lose about 10 months of learning, have 10 months of learning losses, Latina kids about 8 months, and low-income kids a year. You just think about that in a decade. My daughter, by the grace of somebody's God, is going to be okay because I've had to put out a whole lot of money in tutors and others. But think about the lost generations of kids where we fought very hard for the Brown versus Board of Education decision for equal conditions to the resources needed to learn. Think about what that's going to look for the future of industry. They will not be prepared. And again, I can only go back to this group because what we're finding is that you are no longer in an inline economy, an in-person delivery model. You are now in an online delivery model. This is the future of the way that this new normal is going to look like. But to the positive side of it, there are benefits. I mean, we have found in my research that once you start connecting the dots with broadband access, you actually have great success. You're able to connect young people who are confined to the corners of Hartford to a higher purpose and a higher understanding of what education looks like. You create greater connections between civil society organizations and government. Think about the fact that, you know, you are able to now navigate through some of these processes, whether it's the mitigation of unemployment benefits or connecting to workforce training programs. Now you can actually do that online. I don't know about in Massachusetts, but here in Virginia, you can actually get your driver's license stuff, most of it done online. I mean, these are the general conveniences and productivities that come with being connected. And it will actually help us because in addition to doing digital divide work, I also work on artificial intelligence. I'm the true wonk, technology wonk and nerd. But part of what we're seeing there is that new technology is helping us to come up with the cures and vaccinations and the cross-global cooperation that we're seeing. The challenge is that you just don't want anybody left behind, my friends. You as providers don't want to be left behind as professionals in this space. And so we have to constantly reimagine, what does social service delivery look like? What does the identification and mitigation of poverty look like? How do we leverage the technology as part of the cure or solution versus something that we think is unattainable for certain communities? Now, there will be communities that will be hard to serve, generally. It is like my aunt, who I would like to proudly say turned 99 yesterday, who does not have a cell phone, who does not have, you know, cable. All she has is a bottle of bourbon, and she tells us that's what we should do to live a long life. But I share that because she's at a state where you're probably not going to get her to adopt technology the same way that we all do. But what we need to figure out is how do we get her home healthcare aid worker to actually use that technology, her family. So we were able to do a Zoom working with her healthcare aide that was in the home, leveraging her technology. You see what I'm saying? So we've got to find ways for people who are disconnected to be connected. And those are the positive sides that we're actually seeing, Antwuan, on these digital lapses, where communities are coming together. In the case of communities without broadband in the first part of the pandemic, we saw Wi-Fi enabled school buses parked in rural communities, being able to provide some type of connectivity to families who did not have home broadband access. We saw Wi-Fi hotspots lent out to families. And you all have this arsenal that me as a policymaker, I've been working on with Antwuan for a long time. You have something called the Lifeline program, which actually offers low-income eligible families the opportunity to get a cell phone with a set cap of minutes, but it gives them a communications lifeline, much like we needed with 911 and rotary service. So I want to stay on what Antwuan is talking about, so I'm not as pessimistic. There are solutions in terms of how you actually get beyond those families where they're housing insecure, food insecure, job insecure, income insecure, and you figure out ways to create the type of partnerships that are going to be needed to keep them connected. our ultimate goal as a country is that everybody should have access to some type of connectivity. You live in a housing development, if you don't have it in your home, it should be throughout the housing development, where you can grab a corner, a room, and engage in private transactions like the recertification of your Section 8 in your own comfort of the space in a private, in a protected manner. But we're not there yet. And that's the unfortunate thing about the digital divide, which is why, again, I just am humbled by this invitation, Tekisha and others, because you're the next wave. You are the gaps that are actually being filled in on where technology has failed, both in the marketplace, as Antwuan is talking about, as well as in the individual consumption patterns of people.
I would pick up right where you left off, Nicole, because what I have said here, and I'll say other places, is that the social service patchwork that is the United States approach to a welfare state, right, must be more robust, right? And it must be braided in a way that it is the floor below which people cannot fall. Yes. And broadband is one of the ways that I think we're going to be able to think through. I want to talk a little bit more about these vulnerable communities, particularly as it relates to broadband. What we're seeing now in terms of first responses of responses, right? Particularly for mandatory reporting agencies, for children who are not online, but maybe in shelter systems, right? Who are now homeless as a result of COVID, who don't have access to broadband, therefore not in school, and then now being mandatory reporting, right? And having this accumulated disadvantage. I think this is one of the opportunities for this group to think through how in your planning to unbraid those type of trappings, particularly shelter systems that do not have broadband access. They have broadband access for staff, but they don't have broadband access for folk who are in the system, and some of the perverse incentives that are coming out of that. Additionally, I think it's important here to talk about the operative programming, right? So most of the programming around vulnerable families as it relates to some of the Head Start programs, and then we can shift into some of the energy questions so we can get into that wonkiness, is this 2-gen strategy, right? So the 2-gen strategy, this 2-generational strategy, where we give parents workforce and supports, and we hope that we also support children. But what we're seeing is broadband now is the connection that folk need in order to actualize on those particular things, right? If we're going to use particularly around some of the efficacious models for interventions in social welfare and social service provision, qualifying people to go get work, right, will necessarily mean a subsidy for broadband. And you've talked about a little bit about Lifeline, and at $9 a month, we know that doesn't necessarily cut it in this moment, right? I think also one of the things that we want to talk about as we enter into this winter is the weatherization of the large number of evictions. I get choked up even having to think about it, right? That we know are pending, and people will become housing insecure. And what are the opportunities inside of this conversation for us to both start to think about both mitigation and tracking across the vulnerable populations when people will be displaced, right? And I do think your question about AI is something that we should come back to, particularly for this group, when we're thinking about the classification of some of those algorithms that I think will inform how we do social service provision in the future shortly.
Yeah.
But I wanted to raise this question for you, like inside of those vulnerable populations, what are you seeing?
Yeah, I didn't know Antwuan we were just gonna go back and forth like this. He set me up, you guys. I thought we were supposed to both present together. Hopefully this format is working. Let us know in the chat. But I love this conversation because this is probably one of the more robust conversations I've had in a long time. Because normally I'm just talking at people. I mean, first, let me say this, and this is really a personal area to me, having been a person who's a sociologist in training, but also a person like Antwuan who has history in communities. I mean, when I first started in this space, I was literally tutoring in a public housing development where kids could not read. And I, at that time, used my student credit as a graduate student, used my credit to get these Gateway 386 computers into this public housing center, about 10 of them, and then use that to teach these kids how to read, right? Because at that time we had this thing called CDs that we could put in there and headphones that kids could listen to that were attached to the computer. They were not mobile. And that was, to me, was like the exciting point as a young graduate student to see just how powerful this new tool was going to be. But at the same token, I also witnessed the legacy systems that communities are actually trapped by, and the systems that even providers are trapped by. Like Antwuan said, being able to use the computers or requisition them for administrative purposes, but not give them to the communities to be empowered to actually input their own data and help you in the decision-making for their own families. And today, what we're finding out of all of the areas that have been massively disrupted, transportation, hotel and hospitality, this case management area has not been disrupted. And this is the most important aspect of how we actually have a populace that is competitive in the digital space. Think about it. There are 5 big tech companies that are driving the face of this economy. And you probably have interacted with each one of them, whether you have done a search, you have ordered something and had it delivered to your home, whether or not you have tried to figure out what your friend or your boo is doing. You've used all of them. And they have hired people of color in particular who are low wage and low skilled, but that's the new economy. Whether or not it's fair is another point of another panel, but that's the reality in which we're living in right now. And when I think about this conversation, I think about this separation that we historically have had, Antwuan, between people and agency. And that's where we're kind of stuck right now, because our constituents, our consumers, our customers look on this side and they're digitally disparate. And then we have a charge of federal resources that is equally constrained. And I have to put that out there because I remember being in this space and being really frustrated by the fact that I had to do so many reports to be able to qualify to get my money from the city just to be able to teach people how to use Microsoft Office. But fast forward 20 years later, and guess what? We have this opportunity. And I think, Antwuan, to your point, the opportunity is how do we actually bring along institutions that have been stricken by reductions in funding and have also been sort of held with the huge responsibility of maintaining the type of services and supports that ensure that we do not have the reckoning of poverty. And that's where I think this conversation and the thoughtfulness of this association to have this conversation, I think that this is so meaningful. And what that means, to your point, is we have to acknowledge as a community that we are no longer in line. So we've got to acknowledge that. And those of us that are dependent upon pen and paper will soon find themselves either out of a job or they will find themselves in a different job because the new delivery of services is online. Once you acknowledge that, then it's up to us to figure out, then how do we encourage online activity in ways that do 2 things. 1, maintain the integrity of the systems and the checks and balances that we're trying to have. And 2, allow us to modernize social services in a way that humanizes the person. So in my book, and I'll just end here, I'm making a real big call to universal service reform. Right now in this country, we have universal service that hits along 3 verticals. 1 is infrastructure, which means that we have money allocated to ensure that we can build in rural communities and in places in urban areas where there's little competition of broadband service. We need to do more there. And unfortunately, we spend more money in rural America than we do in urban America. And I can assure you by a nod of heads from all of you on this call that you have people who live in urban parts of Boston, Dorchester, and others that do not have broadband access. And that's the reality that we have to deal with, which is to go back and say we need infrastructure. It is not a rural issue. It's not an urban issue. It's an American issue. We also have, as part of universal service at the federal level, something called the Lifeline program, as I mentioned, and E-rate. The Lifeline program only provides $9.25 to eligible families to get access to broadband service, and primarily on their phone, mobile, because we haven't quite ironed out the ability of people to get broadband through this benefit. That program went into effect in 1986. I'm not gonna ask anybody on this call to tell me if you were born in 1986, but if you were born before then, life is very different than what it was, and $9.25 does not take you very far. And the last thing is around telehealth, particularly for rural areas. And for those of you on this call, if you're not necessarily in rural trying to tend to the telehealth needs of individuals, you won't benefit from this money. In my book, I'm suggesting a couple of things. One, we need to renew the social contract and expand upon universal service. Right now, universal service dollars get refunded by us as Americans in a tax that shows up on our phone bills, our mobile bills, but also it's only funded by the 5 cable companies that used to be 10, and none of the platform companies, Facebook, Google, Amazon, pay into universal service. If they just took 1% of their revenue from ads that they get from our data, we probably could actually make sure everybody had access in this country. The second thing I'm thinking is, how many of you on this call have gone to your mobile provider and gotten an offer to get to their service by them giving you free Spotify or free Netflix or something else? In this country, and I'll go back to the young man in Stanton, Virginia, we don't offer free data for government services. And what I'm suggesting in my book, we should not have people have to count against their minutes if they're going to a .gov to get access to workforce training. It's so counterintuitive. And I'm gonna tell you this, as a policymaker who sits in DC with a lot of people that don't look like Antwuan and I, there's a lot of people who are saying, well, we need to let poor people choose between whether or not they want Netflix or they want to be able to go online to apply for benefits. That is not our decision to make, because technology does not really, it's not structured in a way for us to have those decisions become the game changer. We just need to, what I call, exempt data for anybody who needs to go to a .gov. You have a client that is saying, I need to go and file for my unemployment insurance. It should not count against their minutes if they're on a smartphone, and there should not be a data cap if they're using some type of connectivity from home. And then finally, I would just say for telehealth, it's so important that we have telehealth services for everybody, regardless of where you live. When I was doing this, and I'll just close here, this work, there was a young woman who worked alongside of me who had a child with asthma. We had our kids around the same time. She constantly was in the emergency room handling his asthma attacks, to the point that she would have to take off work and was almost threatened to lose her job because of the wellness of her child. Me, on the other hand, I had health insurance and took my child to our primary care physician, and he actually gave us the right medication, etc. Back then, I thought to myself, if only we had something where she could get a primary care doctor in the middle of the south side of Chicago, she would probably have a better chance of being able to get the care that she needs. You fast forward to the last 10 months, folks, we have that now. It's called telehealth, where many of the people that you work with who may not have the need for vitals to be taken could essentially get on their phone, talk to their doctor, a primary care doctor at that, and actually deal with some of their health disparities. I guess all I'm saying is you got to buy my book. That's the first and foremost thing. It'll come out next year. It's all in there. It's all in there. It's taken me a long time to write this book, so I'm going to tell you, you got to buy my book. But I'm saying that as a policymaker, these are the changes that we need to make at the federal level, and states need to follow, so that there's flexibility in funding, where you all should be able to give every client that you have that has an immediate situation some type of tablet or some type of hotspot, so that they can stay in touch with you. That's the work that Antwuan and I do right now. How do we create an ecology of service that allows our folks to be seen for who they are, humans, and not necessarily people that are often on the wrong side of opportunity.
And this is why I enjoy talking to you and so much, and because I'm in Baltimore and Nicole is in DC, and we don't get to see each other as often in person. I also think that the work here is important, not only for the telehealth, but socializing folk who have been at the margins of this work, because here's the question, right? The COVID pandemic has come in to show us, right, that the disproportionality in both mortality and morbidity is race, right? And now we have to socialize inside of a new set of services that you shouldn't go see your doctor, right? But you should telehealth. And for Black and brown families in particular who were disproportionately poor, that feels like a second class citizenship. And the work that I think your organizations could do is to help to socialize folk into this technology. While you might not be a direct provision of this technology, it is the socialization that this is not a marginalization. Actually, this is at the opportunity to create some very mainstream uses of broadband technology there. And so I want to skip to the questions. I want to co-sign everything that Nicol has said, and skip right to the questions and hear from folk either directly. I see that there's a couple questions in the chat. I thought I saw one. Are there states that are providing free broadband access for persons accessing .gov services?
Not yet. Not that I know. Not yet. I'm working on it. I've been trying to get somebody to do it. This is the life of a struggling policymaker. So I have actually, Antwuan, I don't know about you, but I've been trying to work with, there's a pilot that's actually coming out in about 7 states, 7 cities across the country. One of them is Cleveland, for example. I'm trying to get them to do it. And I've been working to get, it's not a hard lift, but you have to be able to do the technical side of it, which is to do the IP addresses have to be programmed. And I'm not an engineer, but I'm an idealist.
So I'm not an engineer, but all of my jobs have been with engineers, right? And so my first work was with Randall, right? Doing all of that work in Roxbury, Dorchester, Mattapan, in co-locating all of those affordable housing units to ensure that work. What I think is possible, this is what I think is possible, is that in the Northeast, prior to these conversations around austerity that we know are coming, right? The budget talks are already happening. Inside of those conversations are the opportunity by doing, I think I just heard somebody take my idea, which is around micro grants, right? What are the opportunities to provide collective planning and collective braiding of services, the CSBG dollars, CBGD dollars, as well as what we hope will be infrastructure dollars inside of this new work. There's also a question, let's start by micro focus groups. Yes.
Yeah, no, I just to respond to Megan, because I saw that question, I'm sorry. I think that is absolutely the case in terms of Megan's suggestion of sort of doing these case studies and figuring that out. So one of the things I've tried to do with schools, and I'm getting close, is that I picked 3 cities across the country to actually use as a case study to collect everything that they've done, figure out the content themes, and then come back with best practices. Because oftentimes, as you all know, the left hand doesn't know what the right hand is doing. And we create programs that overlay on top of the lived experiences of communities. And so we don't know, we just don't know. There's not been a highly oversampled study of Black and brown communities that tells us about their technology access.
Actually, so my research that I've been working on this year is we have conducted over 300 focus groups.
Okay, perfect.
With folks from across the country about inside of a safety and thriving portfolio, and braided the broadband question in that. We've done that work because we felt like we couldn't get any traction anywhere else, right? And so we needed to, we center equity inside of the work that we do. And so we started to begin to ask folk in an equity framework, what do you need? And what are your needs inside of this conversation? And then we began to do that. Nicol, there's a request for the name of your book. Can you drop it?
Yeah, I'm gonna drop it. It's Digitally Invisible. Okay, get this. How the internet is creating the new underclass. So part of what I didn't get a chance to talk about in the book, because I obviously don't wanna usurp this conversation, but part of it is the new underclass consists of farmers, my friends. It's farmers, it's working class people. It's people who if they had a little bit of broadband, as I found out, they'd be able to do a lot of big things, but they don't have it. And across the country, I found that there were just communities that, they were swat out with nothing, or they just had really poor service because they didn't have any competition. Hartford, Connecticut is one of those places that they had broadband just 6 miles outside of the capital, the 6 miles outside of the capital, young Black girls will walk into McDonald's to do their homework. And so it's things like that that I believe are like the new underclass. And there are things that we actually need to address quickly, particularly as we look at countries like China and Korea and other countries that are accelerated beyond us in their handling of these public health crises, as well as the social supports that they give people. I'll just give people a really great example. I go to China a lot, or used to go to China a lot to go to different conferences. The area in which I went to this conference in China for the last 5 years is a very poor water community. It's absolutely beautiful. It's based on the water, a very traditional community. You literally walk down the street. If anyone's been to China, it's like you could just see the culture just glaring before you. And for those people of color, they don't see no Black people there. I was mistaken for Michelle Obama a couple of times. And a few times they didn't know what to, I had my photo taken. I thought I was famous because that year I had my braids in and they didn't know what to do with me then because this is a very small water town. But every year I go to the same marketplace to buy these cashmere scarves. And this woman who is in her 80s has a smartphone. And she actually gives it to me to translate our conversation. And then she asks me oftentimes if I want to pay through the QR code and really, putting our phones together. It was the most interesting experience I ever had. In countries outside of the United States, they do this. And so part of the reason I wrote this book is because here we are in the most developed part of the world, and yet we still are dealing with this decades-old problem of having people on the wrong side of the digital divide.
So I would just say as a follow-up, I'm actually, this is so funny, we think alike. I'm actually working on a paper that's coming out around what I am calling the resorting of the underclass, and particularly looking at work and the future of work as it relates to essential workers and the classification of worker power inside of this work. What we know disproportionately, right? So the thing that braids throughout all this race is the signal inside of all of the disproportionality that we're seeing. 3 more times likely to contract, twice more likely to die, arcing towards 4 more times likely to contract, 3 more times likely to die as the numbers grow in terms of mortality from COVID. And what COVID has helped us understand, but inside of those numbers that will change life tables for at least a generation, maybe 2. And life tables are the thing by which we think about our national posterity, right? How well off we will be. It is the basis for which we think about census data and everything else. It is the basis for all market economy. And when we think about the resorting of who is a worker and what is essential work, and what we're asking of historically low income, less well-educated folk in terms of participating in the American dream and the American economy, the things are, I get a bit overwhelmed for all of the stories that I've listened to this year and for all of the losses. But I think what the opportunities are is inside of a broadband conversation is thinking through the planning dollars. This is what I like about the Northeast. Massachusetts was innovative in providing the basis for what is now healthcare, universally provisioned. I think also in the Northeast resides the type of construction of models for broadband. I really do believe this, particularly given the way in which budgets are organized in the Northeast. So everywhere from Roxbury, Dorchester, Mattapan, all the way out to Western Massachusetts and other places, it provides an opportunity, I think, to think collectively. I think it also allows us to think collaboratively in a region, right? I think there is a regional strategy here that needs to be thought through in terms of the ways that CAA works locally and is governed locally, but also in the way in which groups like this think collectively in terms of impact.
Yeah. If I could say something too, Antwuan, I'm just looking at the questions as well as I was listening to you. Just a couple of things on the future of work. I do think that it is important for us to also think about this new digital normal as we think about what Antwuan's talking about with the future of work and the skills. As I often joke about my 14-year-old daughter, one thing that was revealed to me not too long ago was the fact that she's actually learning the skills for the new economy. The fact that she's online with her teacher, that they have to do some type of retention of those notes. She has to write notes and reminders, submit her reports online. Think about it, my friends. That is the new economy. That is the new approach to the type of skilling that we will have to give people who will now have to be in disaggregated work environments, decentralized work environments where their manager may not necessarily be right with them. It was interesting, my 18-year-old is about to get his first job, so he starts tomorrow in a retail service store locally. And I was looking at his training materials, and it was reminiscent of when I took a job at Macy's working in New Rochelle. Don't steal, make sure you come to work looking okay, no holes in your jeans, you know, the customer's always right. And guess what? For those establishments who have survived through this pandemic, those are still going to be the norms. But there will be a lot of industries that will be repurposed, which will bring an extra challenge to all of you in terms of the important skills that people need to know. It's not necessarily going to be how you look when you show up. I ain't gonna lie, I got up really early this morning to make sure he got a haircut because I told him it's important to make sure on your first day that your hair is cut because that's what my parents taught me. Make sure you come in presentable. But think about all these kids who are going to be doing internships online. Think about all these workers who will be being asked to work for a place that's decentralized or they cannot go back to an office building. Think about the people that you're going to experience who are going to be afraid to go to work and make this virus become one of the reasons why they have fear due to some pre-existing medical conditions. So things like that are going to change. I think what Antwuan's talking about, being very systematic and being very principled and deliberate around some competencies that you all think are going to be important, I think will make you a game changer in this space as well. But I did want to, I'm sorry.
Go ahead.
I was going to address this data question. One quick charge I would put out to all of you, ask the question of your families if they have broadband access. Start there.
Right.
Just
right.
ask them.
Well, we have to wrap this up, but I want to say first and foremost, thank you, Nicole. Thank you, Antwuan. This was exceptionally engaging for us. I think you've dropped a lot of informative, but also some points of that we can walk away. And I know for what I've been seeing in the chat, one of those can be how we integrate what we've been hearing in our community needs assessment. For Cassie and I, we would like this to be part one and bring you guys back for a part two later in 2021, possibly to kind of pick this up and really see, because it is, the world as we know is going to change, has changed, but also in terms for the communities that we serve, how we're going to have to, utilize the services of broadband and internet and all of that and the digital divide and how we can capture it. I know many of our agencies actually had to themselves experience the shock of it before even servicing their clients. So again, as we wrap up, I want to thank you very much for such an engaging, Antwuan, you were awesome. This lets you know how long both of these folks have been just engaged at this level. And I'm so pleased that we were able to bring an impressive folks to our network to start to really look to mitigate and elevate. I remember that term that you had used, Antwuan, mitigate, and elevate. And I think we have an opportunity to do that with our needs assessment, and there'll be more to come. So thank you very much. And I'm going to pass it over to Deb.
Thank you. And thank you so much for sharing all of that about broadband and getting our minds thinking about how we need to think about access to broadband for our customers. We are at our break time, so everybody can get up and stretch again, maybe get a bite to eat, check your emails, and then come back for 12:15, and we're going to have our national partners panel. I think we're also going to show a couple of our sponsor commercials during this break, so appreciate if you'd watch those as well. Thanks, see you all soon.
Now, more than ever, people need help from their trusted community action agencies. And to help them, you need seamless connections with referral sources and a case management system to manage contracts, guide your services, and measure the outcomes you deliver. We are SMC partners, and we have been serving community action agencies for more than 10 years. SMC, helping the caring. At Mutual of America Financial Group, we believe people make the difference. For 75 years, we've been dedicated to providing premier retirement services to the nonprofit organizations that make our country and the world a better place. We are here for you. Mutual of America Financial Group, Retirement Services and Investments.
All right, welcome back, everyone. We're going to go ahead and get started and have our national partners panel. And I hope everybody had a good break and is ready to get back into the swing of things. We are going to have our national partners join us now for our final session of the symposium. And we have Denise Harlow, the Chief Executive Officer of the National Community Action Partnership, Jenae, Bjelland, the Executive Director of the National Association for State Community Services Programs, Allison Malouf, the Executive Director and General Counsel for Community Action Program Legal Services, or CAPLAW, and David Bradley, the Chief Executive Officer and co-founder of the National Community Action Foundation. Welcome to all of you. I think we're going to spotlight all of you at the same time. That's the plan. And we're going to have each of you speak for just about 10 minutes each, and then we'll open it up for questions and discussion among all of you. So first, just thank you so much for joining us for this symposium. We have a little over 100 people joining us, mostly from across New England, and we've had some really fulfilling sessions, lots to think about, get our minds moving towards how we can move community action forward. So without too much pressure on that, I'll have asked Denise if you would please go first and just give us some ideas for what you're thinking about, what you're working on for the next 10 minutes or so.
Thanks, Deb. I appreciate it, and glad to be with New England today. Appreciate the fall background behind. It's my favorite time of year, so good to be with you. Sorry we're not able to be up experiencing the fall weather and leaves up your way. although many of the leaves are probably already down up your way. This is certainly a unique moment in time, isn't it? Not quite the December that we thought we would be having a year ago. So just want to start off and just say thank you. I know that you have to be tired. You are tired. I know we're tired, but we're not on the front lines serving families every day. And I do have the privilege of being able to talk to executive directors, planners, deputy directors, other leaders in organizations at times about what's going on. And I wish I could talk with more folks. So I look forward to today's conversation, any Q&A that we have, knowing what's going on in your organizations. But please know the Partnerships Board continually dedicates good portions of its board meeting to be talking about the pandemic and the response that the Community Action Network is engaged in. As we look forward to a new administration coming in, it's more important than ever that we find ways at the Partnerships Office and at the state association levels to talk about the work that Community Action is doing. We know that agencies have pivoted. We know agencies have used new technologies. We know that your numbers have increased dramatically. We also know that a Dear Colleague letter has just recently come out. My email just, I think, hit while we were on break here this morning or this afternoon, that data reporting on CARES will be coming, more information. So we know that even in the short term, we have to be thinking about the long-term work that we have ahead of us. So what's coming next, though, is the deployment of vaccinations, right? I know Community Action folks tend to be very adept at keeping apprised of current affairs, and I'm sure you're very apprised in terms of what the science is telling us, the multiple doses, having the temperatures that the vaccines need to be kept at. And I know that you're well aware of the hesitancy of many folks to take the vaccine. Much of that is grounded in our country's history of racial inequity, structural racism, and that mistrust is well-founded. We are hopeful that this vaccine will reach all communities equitably and will be received and put into the arms of folks all across the country. And Community Action, we believe, has a role to play in increasing the trust factor with the vaccinations. And I'm sure David will talk a bit about this as well. But we want you to be prepared, as if at all possible, to figure out how can we, as trusted entities in local communities, spread the message of the role of the vaccine, the importance of the vaccine, as well as the other measures that will still need to be in place for quite a while. Masks, social distancing. A lot of these things will be with us for a while. And as trusted entities in your local communities, you're going to carry a lot of weight in those arguments. And in New England, we know many of you are federally qualified health centers. I know some of you are running assisted living facilities for seniors. There is a focus in the New England part of our country with Community Action more focused in the health space than perhaps in other parts of the country. So your role, you have peers in Region 1 that can share information, share best practices, share policies, most likely. And the NECAP, New England CAP Association, is going to be a great funnel for that information, as are the individual state associations in New England. So I look forward to learning more from Region 1 about what we can learn from you to share with the rest of the country. I mentioned the administrative, certainly the new administration coming in the door, and I'm sure, again, David and Jenae will probably both talk a little bit about this as well, just so you know. The partnership is sharing information with transition teams. As you may have seen, the Biden administration has posted its priority areas, which certainly include the pandemic, racial equity, climate change, and the economy. We're ensuring that folks going into some of those HHS landing teams, or however they're framing them on the Biden side, I should know that off the top of my head, that folks are getting information about the value and impact of community action. That if you want to change the human services ecosystem in this country, that human services are delivered in different formats and in better ways 5 years from now than they are today, that are being highlighted during the pandemic, you should be working with the Community Action Network. We have our hands in every corner of America. So please be aware that we are sharing information and trying to elevate the visibility and perspective of community action with folks coming in the door. We're encouraging, and I'm sure David will talk about this as well, our number one issue is addressing the small states issue. NCAF has been blowing this horn. We have that message in our documents as well, that the small state issue needs to be addressed, and they need to find those administrative issues, regardless of what happens in Congress, to do more sooner rather than later. Here we are on December 9th, and we're aware that very little has happened in terms of the administration on that issue. We also are pushing for flexibility and increased guidance and communication, more timely information, congressional reports, things that administratively a new administration can work on very, very quickly. At the Partnerships Office, we have had now the second meeting of our Equity and Economic Mobility Commission that was established by the board in March of this year. It expands our Racial Equity Advisory Committee that reported to the board over the last 4 years to a full-blown commission across the country. As the Biden administration focuses more on equity, as our country continually works toward racial justice, as community action expands its reach, even this last session that I was able to pop into in terms of equity around broadband, technological aspects of our country. Please, if there's information to share with the commission, please let me know. We're happy to share any information from Region 1 or anywhere across the country with the commission. I will also say I haven't really said this to too many groups yet, so hot off the press, I guess, we are reestablishing the Head Start Task Force. There are many issues that we have seen in Head Start. This has been in development for a while, and COVID has kind of jammed us up a little bit, so my apologies for not getting it out sooner. But we are constituting a task force that will engage executive directors and Head Start directors from regions all over the country, because we believe the best Head Start programs operate within a community action environment. And with the new administration coming in, definitely, we want to make sure that the new administration understands and sees the value of Head Start embedded in a community action agency. Because again, we're focused on a whole family approach, or 2-gen, whatever frame you want to use. And Head Start is a critical foundation of that. But it's also not the only piece, right? We have to focus on parents. And I'm pleased to also share with you that the partnership was recently part of an award that went to the American Public Human Services Association to expand SNAP employment and training. And again, I know in New England, there are CAP agencies engaged in SNAP employment and training, and we're going to want to learn from you. And we've just hired a new senior associate, Steph Smith, to run that program. So keep an eye out. We're going to need you to expand SNAP employment and training, especially as we work our way through the economic recovery from this pandemic. So come August is our annual convention, and we are due to be in Boston. We are due to be in Region 1. God willing, right? It is scheduled for August 30th through September 3rd. We hope that many of you in Region 1 will join us. We are hopeful that the vaccinations, that mask wearing, that social distancing will allow us to meet in person, if not the entirety of the conference, at least a portion of the conference. So, and my guess is the hotel's not going to let us out of a contract either by that point. So that's another thing we're going to have to navigate. But I encourage you to keep that on your calendar, August 30th through September 1st. And our winter conference is going virtual. I believe it's February 1 through 3 off the top of my head. We have secured Dr. Ibram Kendi, author of How to Be an Anti-Racist, to join us as our keynoter. And we're also pleased to announce that Dr. Gail Christopher, who has joined us in the past, will be our moderator with Dr. Kendi. She understands community action. She understands our network, and we're pleased that that panel will be incredibly powerful. It's going to be virtual. We're soon to open registration. I don't know if it's quite out the door yet, but soon. So I hope that you will join us then. And finally, just on the business side of things, I know Jovita is sending out membership invoices this week. They're a little bit late, but we need to set up an electronic system, knowing that virtual submission of membership invoices is probably a critical part this year. So I hope that you will renew your membership in the Community Action Partnership. We so value being able to serve the network, and I hope that you're finding a value and a return on your membership dollar. So with that, I'm going to turn it back over to Deb, and I look forward to the rest of the panelists and our Q&A later this afternoon. Thank you.
Great, thank you, Denise. Jenae.
Good afternoon, everyone. I bring greetings from our board president, Ms. Beverly Buchanan, who is the Arkansas CCG grant manager, as well as the whole team at NASCSP. I know that you've had a wonderfully packed agenda balanced with critical programmatic updates, as well as really timely discussions about the role of social justice with community action and how we can impact the digital divide. I want to take this time to share my sincere appreciation for all of your work. I've been with the network for over 20 years, and I can say that this has been the most challenging year that I've ever had to work with. But I will say it has reaffirmed my dedication to community action. I've seen you all rise to the challenge of operating during an international pandemic, taking action over this year to offer new services in different ways, reaching out to each other virtually, such as what we're doing right now, figuring out how we can still support our families in need, and having families access our services more than ever before. As you know, NASCSP, we are the state association for weatherization and CSPG offices, and I see some of my state members on the call today. And I just want to say that we have been working with our state offices closely to ensure that they're supporting all of the work of the local agencies and the state associations. We do this in partnership with the Department of Energy and with the Office of Community Services. And that while we have all been working remotely, I'll say that I feel like we've been more connected ever than before because we're really reaching out to each other and figuring out how we can meet the needs that we're seeing right now. This past year, the national partners, for the first time ever, held our regular town halls between NASCSP, NCAP, NCAF, and CAPLAW. And I want to thank David, Denise, and Allison for really working together to share the information with the network on what we were seeing as things were happening. We know that sometimes there was information that was delayed coming out from OCS or DOE, and so us being able to really talk with you all to share what we're seeing at the national level was critical, but even more critical was hearing from all of you what your needs are, what you're seeing, how we can advocate on your behalf. We also meet every Friday with the state associations, and we do that because we want to see at the state level what the associations are seeing so that we as national training and technical assistance providers can really ensure that we're continuing that message forward. For CSPG, Denise mentioned that one of the biggest outliers that we're still working on is what is going to happen with the CSPG CARES report. I can let you know that we're finally seeing some good movement on that we are meeting with OCS and the Data Task Force next week to discuss the needs of the network on how to do this report. We acknowledge that this is incredibly challenging for all of you because you've already been serving these individuals and families. And so our recommendations have been not to change the reporting from what you've currently been doing for CSPG, but also reinforcing the critical importance of showing the strength, the flexibility, and the fast action of what community action has done during this pandemic. And that's what we get from the report. You've heard me speak before, and you know that reporting to me is not just something that you check off the box to get the funding. It's a way of showing the power of community action. And we want to ensure that we work with you to do that. Along those lines, as Denise had mentioned, we are working at NASCSP with the HHS transition team as well as the Department of Energy transition teams. We know that anytime that there is an administration change, it is critically important that we work together to show how vital our programs are. And we want to ensure that as they're making these appointments, they are making appointments in the minds of community action has been around for 50 years, weatherization for over 44 years, and yet we are still dynamic and we are the network that they need to support, that they don't need to create something different. We do know that there are challenges when you get $1 billion of CSPG funds. It's that influx of funding, and that as community action agencies, you didn't just receive CSPG funds, you also received a multitude of other CARES funding as well. With that comes the review teams. We already have been contacted by GAO, the Government Accounting Office, to start a review of how CSPG CARES is being utilized at the state level and local level, and what the response has been from OCS. We know that with Recovery Act, it wasn't just GAO who was in and monitoring these, but it was also the IG office. So we've been working with our states to ensure that they know how to keep accounting of all of the funds that you're using, and to do this in a new world with the pandemic. That when we're talking about monitoring, we know that on-site monitoring is not going to be happening until it's safe, but there's still a lot of reviews that we can be doing without it being a burden to all of you, because our focus first and foremost is ensuring that the funds get quickly to the local agencies and to the families and the individuals who need them. With weatherization, I will say that weatherization in 2021 is stronger than it was with Recovery Act and with the Obama period, that we've implemented so many amazing things with weatherization, which include the quality work plan, using computerized audits. DOE has instituted continuous improvement so that they can hear from the local agencies and states on what needs to change. With that said, COVID has had a major impact on weatherization. We know that we're in the winter months now, and more than ever, we're spending time in our homes, and we need to ensure that they're energy efficient and warm. And yet right now, we're seeing that we're slowing down production again. That we did a national survey at NASCSP with our states, and on average, production was paused for 81 days, but that doesn't mean that weatherization wasn't still at work. During that time that we weren't able to go into homes, we were doing trainings, we were looking at our health and safety impacts. We were developing new protocols for weatherization trainers. We will say that despite the shutdowns that we saw across the nation, we were able to avoid layoffs for a majority of our contractors and our workers by doing these trainings and also deploying them to other programs. We know that we're entering into another phase of shutdowns, and so we want to ensure that we continue that momentum that we did with the first phase. There have been several factors that we're working with weatherization that has also been challenging for us. It's not only that we haven't been able to get into homes, but now we have a whole new layer of client education that we need to share with our clients about the safety of going into their homes, that we have to ensure that our workers and contractors are fully protected when they go into the homes as well, that we've had several delays in appliance shortages, our refrigerators, freezers, and HVAC. So I just want to let you know that we're dedicated to working on these challenges. We did meet with the Energy Efficiency Group and the DOE transition team yesterday to share with them what's happening with weatherization now. And we're excited that Biden has mentioned that weatherization is on his radar and that he wants to weatherize 2 million homes. What we do say is that we're advocating that any additional stimulus funds that are added to weatherization come with a long expenditure period, that we don't want to be flooded with a large amount of money in a short amount of time. Because right now, what we have to do is we have to ramp back up to pre-COVID times. We have to then hire and train, and we want to ensure that we do the best work as possible. So what we're saying is that if there is a stimulus package, we would like it to be expended at least over 10 years. So that way it gives us enough time to adequately prepare. And these are lessons learned that we have from Recovery Act. Our NASCSP staff has been really dedicated in preparing our own virtual conferences, in looking at how we provide training and technical assistance. We have a dedicated team for our CSPG team and our weatherization team. We were hiring right now, and we're doing interviews for a weatherization program manager, and that's because Amy Klusmeyer has now transitioned over to the Department of Energy, which we're extremely excited for her because they need all the help that they can get over there with everything that's happening with the transition. And I will say that I'm excited for what we can see on the weatherization side with our hiring process and with CSPG continuing forward. I know that we have time for panel discussions, and I didn't cover everything, but I want to ensure that there's enough time for Allison and David to cover what they want to give for updates as well. So thank you again for inviting NASCSP. I'm honored to be here, and I can't wait to see you in person soon.
Thank you, Jenae. Allison.
Yeah, thanks. I can attest that there are no more leaves on the trees, Denise, as I am in Boston, as you know, and that we are all cold up here right now. I think that goes for everyone. So that's, I think I can speak for New England on that. But we're doing what we do up here, so that's great. I'm happy to be here. I'm happy to be talking to everyone today and to give you some updates on what CAPLAW is working on. I will say that while this has been one of the most challenging times in, I think, my work career, and I'm sure others can say that, I think in many ways it's been an emboldening time. It's really pushed me, and I think I've noticed with community action, to sort of achieve changes and the way in which we operate that have been exciting and interesting and fascinating, and sometimes it sometimes takes situations like this to make us realize that we really can do so much more than we thought we could ever do. I feel like I learn that every day with everything I do. And I'm, you know, I'm inspired every time I talk to community action agencies and find out how they're making this time really work and doing everything they can do. So I echo the gratitude to all of you guys on that front. Just a few key things, and then I'll turn it over to David, because I know he's got a lot of information to share with us about what's going on in his world and how it impacts our world. We at CAPLAW are focused on a lot of CARES related matters and issues. That's the CARES Act funding, and also pandemic relief measures. One in particular that is set to expire is the Families First Coronavirus Relief Act leave. That's the leave that I think a lot of you guys are probably familiar with, that applies to certain situations for employees who are faced with COVID issues and taking care of their family. There's paid sick leave in there and paid FMLA leave, which is the first time FMLA leave has ever been paid. And so we're going to be issuing some guidance actually tomorrow to remind everyone about that leave. We've been getting a lot of questions about it, and to also, you know, give you a heads up that for now it is coming to an end as of December 31st. You know, with the new administration, we do expect things to kick back up again, and I'm sure David can give us a lot of information on what we can expect, at least with the next COVID relief bill that Congress is currently working on. We also just released yesterday an email to let everybody know about the updates that we've been doing with respect to 2 resources that we currently have out there that are focused on CARES issues. One is the readiness resource that it was put out there to help community action agencies think about how they're responding to the pandemic and the crisis, how they're managing COVID-related issues with clients and employees, and also help to educate everyone about the potential liability with respect to how we're operating. So we have added a few questions, we've updated the questions, so please take a look at that resource. And then also a resource around the loans that were offered under the CARES Act, and that's like the PPP loan, and also the tax credits that were offered. We want to bring everyone's attention to those resources and let you know that we have been updating them and did recently a big review and update of those. We also did some webinars on revisions to the uniform guidance, which isn't pandemic related, but is really important. There were revisions that went into effect as of November 14th for any grants that were issued after that date. So they're not in effect now for your current grants, but they will go into effect moving forward. So we want to make sure that the network is prepared and ready to take advantage of some of the revisions, because they are very positive, but also able to manage and be responsive to them when they do come into play for your different grants. As far as what's up and coming with respect to the resources that we're working on, a lot of it is COVID and pandemic related. We are preparing an employment law webinar series that's going to focus on managing workforces during this time, on leave issues, wage and hour issues. And so we look forward to making that available to the network. And we're also working on a resource about the democratic selection process with the tripartite board and the low income sector of that board, as well as a resource around bylaws and governance and helping organizations respond quickly and have the measures in place that enable them to respond and act quickly during this time and future times, to be prepared for that. And we are preparing a remote workplace policy that we hope will be helpful to the network. And, you know, even though we're doing it specifically with response to this pandemic, again, as I mentioned, the pandemic has really opened, I think, a lot of our eyes as to how we function as a network and what are the possibilities there. And some of the ways are resulting in some cost savings. So I think it's important to think about the future as well when we're sort of putting these changes in place and what our future will look like. Many of you might have seen with respect to the executive order that came out in the fall from the Trump administration that addressed doing trainings on race and equity, that there have been some lawsuits filed by civil rights groups with respect to that executive order. CAPLAW did issue a news update, a news alert about it, and explained to the network that at this point in time, the order applies, the restrictions in the order apply only to federal contractors, and community action agencies are grantees. And so the order specifically says that federal agencies are to look at the order and decide how and if it would apply to federal grantees and to the different programs. And we have not heard anything to date from any federal agency with respect to taking that order and applying it to its federally funded programs. Our thought is that when the new administration comes in, and David can likely speak to this, that, and I think this has been in the news, that Biden is going to take a heavy hand to all of the existing executive orders, and most, if not all of them, will be rescinded. So our hope is that will no longer be an issue that we need to even think about at this time, but rather thinking about that training and how we can do that training and help to our network be educated in these areas. And then last but not least, I just want to let everybody know, it's a little bit hard to say, but it's an inevitability that CAPLAW's conference in 2021 will be virtual. It will not be in person. The dates will be the same. It'll be Tuesday, June 29th through Thursday, July 1st. Those were our original dates when we were hoping to see everybody in Austin, Texas, which seems so great right now because I'm sure it's warm there. But unfortunately, due to the circumstances and so many unknowns, we felt it was in the network's best interest from a safety perspective, as well as ours, to just go full force on a virtual conference. So we're very excited about it, and we will be sending information out about it over the next month or so, and you'll be getting a save the date soon for that. So, and with that, I'll turn it back over to Deb and then to David, I think.
Great, thank you. And welcome to David. Welcome, David, to New England, the power hub of the incoming Congress as far as taxing and spending goes. We're all very excited about that. We're all looking forward to your insights.
Okay, well, thanks for inviting me to another Zoom session. It seems there's only about 5,000 of these, I know, but I appreciate the invite. And I start off with the realization there's only 22 days left in 2020, just 22 days to get through this challenging year, 42 days until we have a new president, and hopefully some of the drama and the melodrama and the fatigue and the exhaustion will at least evaporate somewhat in Washington. This has been a difficult year. I'm sure almost every speaker said, boy, what a tough year. It has been a challenging year for all of us, for the planet, for this country, for our agencies, for the communities we serve on a variety of fronts. But it's also been a year that is important to remember, a year of opportunity. And I want to talk a little bit about the opportunity and lessons in 2020 and how it applies to 2021. And when I say a little bit, I'm reminded that I've got 8 minutes to go over all the highlights of 2020 and what we're expecting in 2021. Let me go through the challenges. I don't need to to list all the time, but the challenges, and give you a complete list, but the challenges we faced were the devastating impact of COVID-19 in particularly in our communities, communities of color and low-income communities. The social unrest, the disparity on justice, the disparity on opportunity, this disparity on health, the disparities on education, on housing, on transportation, on opportunity, as I said. All of those were in the forefront. So when we had to go virtual, all of us, and basically Washington shut down, what crossed my mind is the same thing that you had to deal with. How are we going to do it? How are we going to operate in this new world? And what's it going to mean for our programs? A couple of good things very quickly, and then the points I want to make. The years and years of sort of walking the halls of Congress paid off. Relationships that you have locally, relationships that we have in Congress paid off. And so things that we wanted to accomplish, we were able to. And the CARES Act, I'm proud of the $1 billion. I'm more proud of the fact that our network came through. We passed that with flying colors. Locally, our agencies were terrific. Not everyone, not all the partners in terms of some of the states or even OCS were completely ready, but overall this network did well. So number one, good job on the CARES Act. And second, what we know is that the CARES Act, that $1 billion has leveraged unbelievable recognition in Congress of the value of this network. And you're going to hear about that right now. Literally, almost every day, a member of Congress or staff are asking about some other opportunity for the Community Action Network. And it's besides just the CSBG portion, what we've done on the COVID relief through HHS, what we've done on other programs affect or included in the CARES Act, those resources going to community action agencies, we've done very, very well. The appropriations, whether it's LIHEAP, whether it's Head Start, whether it's CSBG, weatherization, we're all headed in the right direction. Most importantly, we're headed in the right direction with members on both sides of the aisle claiming credit for funding levels, for support for the programs. I laugh, I smile. You've done well when members of Congress who had nothing to do with either appropriations, regular appropriations, or and particularly on the CARES Act $1 billion, when members of Congress are out there taking credits, and I got you that money. Chuck Schumer told the New York mayors that he got them $1 billion for CSBG and the CARES Act. He had nothing to do with it. Of course, we say, thank you, Chuck, and hope you do it again, but that's what you want. So to come out of 2020 with both parties claiming credit and a high degree of confidence in the work that the agency does is very, very good. There are issues, though, that are still challenging in 2020. The small state fix, what we do life after CARES, the supplemental that's going on, which I'll talk about, finalizing 2020 appropriations and getting ready, or 2021 appropriations, and getting ready for the message and the opportunities in a new Congress and with a new administration. Very quickly. Congress goes out in 9 days. I have 4 minutes. Congress goes out in 9 days. They've got 3 things they've got to do. They've got number one, to finish the appropriations process for FY 2021. Second, whatever they're going to do on stimulus. And third, they got the Defense Authorization Act. Everything else is secondary. But the first 2 are linked. So here's, if I never have the opportunity to talk to you again for the next 9 days, keep an eye on this. Any hour of the day, depending on who you talk to, you're going to either be optimistic on the stimulus or pessimistic. I mean, those that are involved with the sort of the gang of 10 on the Senate side, talked to 2 members yesterday, at least chiefs of staff. They're optimistic. People around that in the Senate are pessimistic that they're going to get things done. I think it's 50-50, and that they're going to get a stimulus package done. There's still some issues that divide. Democrats are playing hardball as they should. McConnell has not moved as much as he should. The administration is engaged, but Democrats are playing hard because they fully expect, with a new administration and a new Congress, an incredibly robust stimulus early next year, post January 20th. And so they're not going to give up easily here because they've got, they can put a lot of things in the next stimulus. But even if they agree to a stimulus, that has to have a vehicle, and it's going to be to get through Congress, and it's going to be combined with the appropriations bills, and they're not going well. Conferencing 11 of the 12 bills, Homeland Security separated, 11 of the 12 bills, trying to put those in a package. Members are having a hard time. It's not going well. Press hadn't talked about it, but keep an eye on that. They are linked. Going forward, in a new Congress, in 2 minutes, very, very quickly. Number one, the goals are as follows. Small state fix in the first opportunity. It is, some members are saying they're going to do it in the regular appropriation cycle this year. I'm not seeing it. Members that are saying they're on it, it's not happening. And so I'm not optimistic that it's going to be fixed through legislation in December. Doesn't mean we've given up, but I'm not optimistic. I'm hopeful, but not optimistic. Second, there is a chance that Congress will do a continuing resolution if they can't reach agreement until the middle of January, the end of January next year. Third, the Congress is looking at, and this is the value, the most important thing I'm saying on this talk, Congress, because of the CARES Act, because of the CAPP response, members that have never engaged on the programs, our programs before, are asking questions about how to utilize the strength of the network for various needs. Just in the last 2 weeks, very direct approach on a program for veterans that includes community action agencies. As has been referred to a couple times on this, heavy engagement on vaccine education, outreach, comfort levels in our communities. You know, whether it's with CDC, but it's primarily with Democrats who are working on that portion of this stimulus and the next stimulus, a major CAP role on that. Third is some demonstrations that cross agency boundaries, HUD, DOE, labor, HHS, that highlight our programs, the multitude of programs that we run. Fourth is ideas on mortgage assistance and rental assistance abatement through supplementals, through existing programs on utilizing the CAP network. So I view 2020 as one of the most challenging years any of us will ever face. But I also view it as setting the seeds and planting the seeds for a year of incredible opportunity next year. And the only thing that should limit us is our willingness to reach high. We should absolutely aim as big as we can, as high as we can, because the willingness to invest in this network in 40 years has never been greater than it is now. And it all is because of the work that the network has done during America's most challenging moment. So thank you very much.
Thank you. And we are going to move to question and answer. So all of you who have been listening, if you have questions, you can either put them in the chat box or you can use the raise my hand function in the participants bar. But I'll kick things off first and ask for all of you, really, how do we move past thinking ourselves as a network in competition for dollars and resources with other organizations and other networks, and towards a partnership where we can utilize our breadth of services and programs and our ties to the community to work with other organizations and leverage all of those resources to help the people that we serve.
I can take a stab at that, Deb. I think it's something that where community action is grounded in family-centered approach, right? Family-centered design. We can use all that parlance and fancy language every day, but it really does mean something to community action. It's that sense that the family's needs come first. That doesn't negate the turf stuff, the financial stuff, the competitive stuff that happens in local communities at state level, even at the national level, right? It's an interesting balance to try to walk that. I think local agencies play a great role as convener. In this moment where monies are being funneled through community action, it gives you an opportunity to be kind of a lead agency role or a hub organization for various funding streams. I've often found that sharing resources, even through a contractual relationship, can build stronger relationships. There's trust, there's accountability kind of built into that sauce. But in this moment in time, I mean, I talked a little bit about how 5 years from now, we can't see human services being delivered this way. And if you think about, I hate to, the human services value curve is very techie, I know, but it talks about moving to what's called a generative model, which talks about it's family focused, it's outcome focused. And that's where community action sits. It's not easy because the money still matters and those relationships still matter. And it comes down to people, but I've seen community action agencies are really at the forefront of being able to partner and contract with other community-based organizations. You're already working closely oftentimes with other national networks, whether that's United Way, Boys and Girls Club, Catholic Charities, United Jewish Federation. There are a variety of ways that CAP agencies are already doing that. We're going to have to figure out how we blend and braid funding streams. And there's an opportunity. I'm glad to hear David say they're talking even at the congressional level about HUD, DOE, HHS funding. So we can talk blending and braiding all day long, but unless those administrative changes and rules change, it gets really hard to de-silo. And we've been talking de-siloing, for decades. But we are well positioned to do that, I think, moving forward. I think the human services think tank folks are really focused on that. If we can be the legs on the ground, we can lead the way.
I'd like to, Deb, jump in. I think it's a good question, but it's also a difficult question, and it's follows. There are issues that, for the good of the nation, for the good of our society, that we should join as big a coalition as possible to bring about change. And just look at the poverty agenda that a number of members, led Barbara Lee in particular, are leading on issues that affect our communities. We need to join the bigger fights, the more important fights. But there's also a role, and that's what NCAF has to do, to ask a very obnoxious question on partnerships and on coalitions. And it's this: what's in it for the CAPs? That's our role. We get asked a lot of times to participate, but when you get increases, when you get funding, people want access to that. So someone has to ask that question. At the end of the day, what's in it for the CAPs? Does it create more respect, more responsibility, more future opportunity, and more resources? So I think that is a very delicate balance of the good versus the needs of the network. So I don't say it publicly in meetings, what's in it for the CAPs, but hell, I think about it all the time.
And maybe best framed up as toward better services and programs for our customers, right?
Through community action.
Right. Jack from Plymouth has put in the chat box, everything today is about love your neighbor, from wearing masks to assisting everyone that is in need. It's not about competition. Do you all have any reflections on that?
Well, you can support funding for a variety of low-income programs. You can participate in and work to get LIHEAP funding or weatherization funding or fit in the Community Action Network in climate change. But at the end of the day, you also have to make sure that you've done everything you can to make sure that resources continue to flow to our agencies. And that is, that takes some work. And it takes some constant recognition of the value of the network.
I think that this moment in time is unique. We look at the lines of those drive-through food pantry, and many of you as local agencies are running the drive-through food pantries with long lines. 6 months from now, we hope, right, many folks will be back employed. Those lines will be shorter as vaccines and recovery takes place. What can we do to expand on the love thy neighbor piece to make sure that we talk about the systemic issues that cause families every day to need the benefits of food, utility assistance, emergency housing, that many of us recognize that there is a narrative change that needs to happen about people who are families who are struggling. How many families in America are one paycheck away and are now experiencing that? So there's an opportunity there to talk differently about human services and to talk about the emergency needs. You hear everything from universal basic income to, I've read something recently about housing access and universality about that. There's different ways that are going to be coming at us to talk differently about our neighbor. That this moment in time is something that we're going to not. It's an opportunity for us to really say poverty is a systemic issue, and we need systemic changes to end poverty in America.
Yeah.
Yeah.
I go back to, sorry, Allison.
Oh, you
I
go
go
ahead.
back to the core missions of community action. When we talk about we are the lead anti-poverty agencies, I know that's overwhelming to many of us, but that is how we were started. And that doesn't mean that we have to be the end all be all, that we work together in collaboration to be able to provide what our community needs. CSBG is that flexible fund that communities determine how to engage in their local areas on what exactly they need. For tripartite boards, I see that as a huge benefit of community action when we talk about what's happening in our conversation across America today, ensuring that everybody is at the table with equal voices, that we develop that so that the low income sector, and I would say that we want to ensure that we're racially looking at the equality that we have on our boards, are at the same place as our public elected officials and our businesses. That we started during the civil rights movement, that we started because we saw that there was a need to really have actionable resources that were developed at the local level and that were really spread throughout everything. And we were the only game in town for a long time. Now we're not. And the turf wars that I kind of hear back there, it's more about how you can support each other and further the work of the dollar that we have throughout the community.
And Deb, if I could, there were three purposes assigned to community action, 1964 and 65. One is deliver current programs, but in new and better ways. Second is to create new programs to meet unmet needs. And the third was to bring about social change. This is the moment that all three of those have come together and for this network. At some point, deficits are going to be an issue, and life is going to get, you got to prove your worth. So we better be running our programs as well as we can at all levels. Second, the innovation, the cutting edge, new programs, new approaches to meet unmet needs. That's what's happening now in Congress. And third, if ever there was a time that we're engaged in bringing about social change, from the 1960s to now, 64, 65, that period, yes, but this period just as much. So all three of the uniqueness aspects of what those in 64 envisioned about the program are front and center in our lives right now. This is a unique moment.
Yeah, and I would add too, I do think it's important as an organization to, focus on what you do best. And so when you're thinking about partnering with other organizations, I do think there's room there because, there could be issues with, especially in times like this, where you want to try to meet every single need that's out there. And while community action is a very expansive network in that we really do focus, we're trying to hit all of the factors that could affect someone's ability to make to move from the economic situation that they're in to a different economic situation. There is the issue of which has been a common issue across all nonprofits and organizations that provide services, that you weaken what you're strong at by overextending to try to address every need. So I do think there is some thought that could be given to making sure that as an organization you are focusing on your strengths and you're really optimizing those, so that when we do hit a time when funding could be tighter, you're in a stronger position to say, look, we're extremely successful, and we're extremely successful in some very key ways. Though I'm totally a fan of David's "what's in it for me." I think you should always keep that in the back of your mind. I do not dismiss that at all. The other thing I just wanted to just comment on is was something that Denise said that I think is really interesting to think about, is during this time, we are seeing a lot of what I would think are sort of transients, a transient sort of poverty situation, right? Where we fully expect some people who might be in need of our services now moving out quite quickly from that, getting employment, getting back on their feet. But I do think this is a moment that could be an epiphany for a lot of our communities to sort of realize, look, this is what it feels like for a lot of people who've experienced this prior to the pandemic and who won't have quite as an easy of a time transitioning out of it. So I think this is a moment of reflection for so many people. And I think it's a moment that community action can sort of say, find some backing in their communities, because unfortunately, those who wouldn't have never thought that they could be in that circumstance were in it, even if it's for a fleeting instance as compared to others who've, struggled for many years to overcome. So I do think there's some area there.
Yeah, and we've spent the last 2 days talking a lot about racial justice, social justice, how community action can play a role. Today, we spent some time on health disparities and health equity, and how community action agencies can play a role there too, the digital divide. So there are so many separate issues that all combine to impact a person's poverty level, their station, their ability to become successful economically and self-sustainable. So do you have any thoughts for our network on, like you said, Allison, not getting too broad and losing focus, but also ensuring that policymakers understand that all of this is interconnected and all of this impacts poverty for people today, but then into the next generation as well. And David, would love your thoughts too on how to message that for advocacy purposes.
Well, I'll let the others start, and I think I've sort of talked more than my allotted time. So let the others start, and I'll be glad to give you my thoughts on it.
I'll start and say that when you are telling the story of your organization and the impact, you have to think about the external audience, right? I would point folks to the Reframing Institute. They've done a lot of work on human services, child welfare, hunger, in terms of how to use what language when speaking to an external audience about the challenges of families. They talk a lot about the construction metaphor and talking about that all families and family well-being are places where you can kind of ground some of your language. But I think that the changing of the narrative is a critical place for community action. We understand that poverty is complex, poverty is local, and every family faces different sets of challenges. It's telling that story is the lift, but there's no better spokesperson than people themselves. The customer voice is critical on that.
I would add to that when we're telling our story, we need to also ensure that, as we've all spoken about, it is systemic changes that have to occur, and that things don't happen overnight, but we are going to have people, as Allison and Denise said, transition out. So getting their stories, but also focusing on the impact on community action, that we had to change how we operated, and we did. That we quickly put up tents to be able to serve people in parking lots, that we quickly figured out how to change things to be virtually intakes, and that we modified that because we knew that we had to be able to safely provide the services still. And that building up the agency capacity and that acknowledgement that, yes, we need to serve the individuals and families, but we can't do that unless our agency is healthy themselves, unless our agency has their own internet bandwidth connection. That digital divide that we talk about, affects us as well. And so also remembering to talk about what the role of community action is specifically in being able to do that, and the strength of that.
Allison, I'll follow you.
Okay, I feel like what you're going to say is going to be good now. You built it up, David. I just would just quickly add, because I know we're kind of short on time. To me, I think what Jenae and Denise are saying is kind of boiled it down to sort of one word, and that's reflection. Like, this has been such a crazy time, and I think it's hard to take a moment to step back and reflect on where we were and where we are now, and how much we've accomplished in this very challenging time in such a short period of time. But we have to not lose sight of that, and we have to note it. And I sometimes take a breath and remind myself of that, just with respect to my organization. And it's somewhat overwhelming, but then again, it's inspiring. And I think it's really taking that and capitalizing on that. That's what's going to make us distinct and unique. And what continues to make us distinct and unique is we really, as a network, have our pulse. We have our finger on this pulse that I don't think any other organization to date that serves the communities that we serve have this finger, have this contact with those that we serve. And it's because of the way we're structured. It's because of the purposes that we served and that we've done it for so long. So there is stuff that's there that we can continue to kind of talk about, but then talk about it in the new framework that we're living in now. Okay, go, David. Now I want to know what you're going to say.
No, I was just going to say, Allison said it all. The environment we're in now, I talked about the opportunities, but we should all remember that we are a community, and that if you're in Connecticut or Massachusetts, you're not alone. There's people in North Dakota and Missouri and Oregon dealing a lot of times with the same things you are and the same problems, and figuring out how to meet unusual, critical community needs. So we have a support system, a support group. We are one as a program. Second, we've been around for 56 years. And the good news about that is that somebody out there has created a program or responded to a need that Congress might be asking about. They might be saying, what can you do in the area of broadband? Or what can you do on vaccines? Or what can you do with with veterans, or what can you do with Army bases, those families that are 30% that are below the poverty line. We've done it. There's CAPs out there that have absolutely developed the blueprint for what we want to follow. That's exciting. That is absolutely incredible. And that's the environment that's going on now. And so, the social change is going to take all of us saying, this is for the good of the country, for the good of the community, for the good of the country. This is a fight we have to make. And we will. And NCAF's got to do a better job on joining those coalitions. But we're not going to only do that. We want to take advantage of this moment in which so many members on a bipartisan basis are reaching out saying, how can you help us on the disparity of rural broadband, or how can you help us on climate change? So many things that they're looking to the network to do. That's the moment we've all strived for. That's the moment we've been waiting for. And with the incoming Biden administration, in a lot of ways, it's old home week. It's people that we dealt with when they're in the Congress, whether it's Marcia Fudge or HHS, or some of the people that might get at DOE. It's people that we've dealt with. Our future in this critical moment is in our hands. It truly is. So let's set our sights high. Let's aim big, knowing that we're not going to succeed on everything. But I'd rather try and fail than not try at all. That's what this moment is about. If we all do it together, we can surprise ourselves and I think surprise a lot of people that work in Washington and control a lot of money and a lot of policy and a lot of initiatives. It's a good moment to be in community action.
Great. We have one last question, and it's from Amos Smith from the Community Action Agency of New Haven. Amos, you're unmuted.
Thank you, Deb. My question is probably targeted more towards Deb Poland and Denise Harlow. And it may be an encouragement as much as it is a question. In light of COVID's sort of revealing that there were three issues that were prominent, not just in our community, but across the nation. And the issues, I call it the 3 H's plus an O. And it's hunger, housing, and healthcare. Is it possible the O is lack of opportunity because of the issues of essential workers not being able to maintain work unless they put themselves at risk? I wonder if we might try and identify some institutional partners to help us do some research. Because one of the things we said to the general public was that these weren't new issues for us. The pandemic basically exacerbated these already existing issues. And I wonder if we might not launch both at the regional, state, and national levels, opportunities to begin to delve a bit more deeper into the intractable issues that are prevented. We all know that poverty is about income and the lack of wealth, but I think that having this proof that the issues that we already have been dealing with didn't change much, it just got worse and more demanding, might require us looking at identifying university partners who might be able to help us do it. If not on a national level, certainly on a region by region or a state by state level. And so my question is basically if that's something that you all might be interested in looking into.
Certainly at the national level, finding university partners I think there's a great value to that. I think there's research to be done, to document, to put into the ether around where community action sits in the center of your 3 H's and the lack of O, right? We've been talking with the American Public Human Services Association, for instance. We've been talking with the American Public Health association we've been talking about with the Association of State and Tribal Health Organizations, developing new relationships on the healthcare side of the equation. And as we begin, as we've been building our muscle on the social determinants frame for a number of years, bringing in the homeless and the housing, we'd be open to that, Amos. So if there, I know you have had connections with university partners and research in the past, we need to create an evidence base of community action. We know there's some out there, but there's always room for more. So we would definitely be interested in that at the national level. It sometimes comes down to resources, both time and financial, in terms of being the size of the organization we are, but there's nothing community action can't do if we put our minds to it. So I'm definitely open to those conversations.
Yeah, one of the things that I just want to highlight is that many of you now have been able to see President-elect Biden's advisory committee on COVID. One of them, Marcella Nunez-Smith, had just agreed just prior to this to work with us around something we were calling our Community Advisory and Research Committee. And so it may be one of the things we're able to take on with her. She's going to remain involved in some of this because we've been working with her and the Yale School of Medicine on community-based participatory research efforts. And so this might be something that really gets their interest.
Fantastic. Yeah, perhaps the Fed might be another national organization that might be able to take a look at the intersectionality of these issues around poverty and how community action can play a role. We have some great universities in New England, so let's work together on that. Yeah. Well, I have one final question for our panelists, and I'll just let all the participants know that I did tell the panelists ahead of time that I was going to ask for this, so I'm not really putting them on the spot, but what is your charge to our network moving into 2021? What should we be working on? How can we be inspired and motivated moving into this next year? And we'll start with you, Denise.
My charge is to encourage you to skate to where the puck's gonna be. We won't get into hockey team specific in New England. I know there are, we won't say anything about that. So go Caps. But the human, and I keep coming back to changing the way we work in human services, changing the human services ecosystem, and it sounds very wonky, but all that is skating to where the puck's gonna be. And I know we've had presenters talk about the transforming the human services system. There's research out there that talks about being outcome focused, becoming family centered, to we understand regulations, but we need to be thinking holistically about our programs and services. And that can mean whole family approach work. That can be blending and braiding of resources. That can mean at the state offices, working with other state offices to find waivers and find opportunities to allow localities and local agencies to do things differently. But we cannot continue to provide, as a country, this fragile system of services for families. We understand the health disparities. We understand poor families can die 20 years young, sooner than families with more resources. We understand the racial and ethnic disparities that exist structurally. We have to change it, and community action is well positioned to do that. So let's keep our eye on the big picture where we can, knowing that we have to work in the micro space. Can you get ready to accept Medicaid? Can you develop more? We just have to figure out what that's going to look like. So my charge is to let's skate to where the puck's going to be and make sure that community action is at the forefront of changing the human services ecosystem.
Thank you. Jenae.
My charge is has already been mentioned, and that is what Allison said, to take a moment and to breathe. And we've been through a year that none of us have ever experienced, and we have so many opportunities, as David had mentioned, in the future, but we have to be centered and we have to be healthy ourselves to be able to move forward. And for me, that's taking a moment to breathe and know that, yes, there's still emergencies out there, but I also have to reflect on the successes that we've had. And yes, there's so many horrible news stories out there, but I need to focus on what I can do to help move forward. And as Denise said, skate towards that puck. So my challenge to you is to take care of yourselves while you're doing this incredibly challenging work. I have found as a network, are so focused on the individuals and families that we serve that we work ourselves to death. And I saw that with Recovery Act. And I don't want to see that during this time. You all are so incredibly important and you have so many amazing ideas. And I just want you to be sure that you and your staff are taking those times to be able to spotlight that. And that can be, you know, a luncheon every now and then that you do virtually. Staying connected with each other while we're remote is important. So that's my charge. It's not a data wonky charge. It's a human charge.
Thank you. Allison.
Yeah, so my charge is to listen, learn, and love. You need to always be open and flexible. Listening is so important, and I feel like that's a skill that is so underrated, and that kind of feeds into the next charge of learning. We have to learn from where we've been. We are constantly, and this is a very legal charge, are constantly being inundated with change. And so we can't address, deal, be flexible with respect to that change if we're not always learning and educating ourselves about, you know, the best way to move forward. And lastly, you know, love, because you have to love what you do and you have to love the people that you're doing it for. And I think that that is true. Everyone that's on this Zoom call today, or else we wouldn't be here. But that's key. That's the driver. That's why we do what we do. We slog through what we slog through. So.
Thank you.
David's calling me. I'm kidding. I'm calling David.
David, what's your charge to us?
Well, to make a difference in the debate on the great issues of the day. That's simple. I read that on a Hallmark card.
Thank you. So 4 charges for all of us. Skate to where the puck is going to be. Take a moment to breathe. Listen, learn, and love. And make a difference in the debate of the great issues of the day. Thank you, all of you, for sharing your insight and your wisdom with us. And thank you to all of you who have spent your time with us over the last couple of days. I hope that you'll take some of the ideas forward to the rest of your teams, to your community action agency, and to your communities. I want to thank all the sponsors one more time. I want to thank the planning committee and the production team and all of our presenters over the last couple of days. Just thank you so much for helping to make this symposium a true value for all of us in the NECAP network. Just one final thought is to be on the lookout for our evaluation form that will be coming by email very shortly, and you'll have the opportunity to enter to win one of Dr. Kalila Brown Dean's books if you complete the evaluation form. We will also separately send out a link to the recordings and the presentations from the symposium from both days. So you'll be receiving those from us as well by email. Thank you again. Everybody have a wonderful afternoon or wonderful rest of the month. If you celebrate holidays, enjoy them safely and in the best way that you can to find meaning in those holidays. And we look forward to seeing you soon. Thank you, everybody.
Thank you.